Namaste, Sat Shri Akal, Adab, and a very good morning to you all. My name is Atul Agarwal, and it's my absolute honor to welcome you all to today's event in recognition of National Minority Mental Health Awareness Month. I know it's in July, but yes, we got to find our space as well as the venue. So it is in June, but the important part is we want to celebrate this. And I would like to firstly thank you to Mona ji to get to me this booking, help me to book this beautiful venue. And then Surinder Kaur ji, since yesterday she is bullying me, but which is okay. But it's okay. You know, when you are a trustee or a manager of some kind of place, then you get used to. You know, I'm a nurse and I work with the manager, so it is always that how do you work under pressure. But yeah. So I'm grateful to Anuji and Satish ji. I will be more grateful when they bring the food. So they are bringing food. So they said, what time? I said, bring it half one because we don't want to smell and then we will have the distraction.
Yummy food.
Yes. So and then the volunteers, since yesterday we are getting a lot of volunteers from Surinder ji, and then they brought this thing and this thing. So I'm very grateful, Surinder ji. And then we had a tea as well yesterday. It was good. And one of the ladies, she is making a sweater for me,
Yes.
isn't it? Something. I think she was knitting something. I thought she's making for me. It was in a pink, but I don't mind. So we are gathered. Last but not most importantly, my thanks to Hannah. Hannah, can you stand up and then we can see that who is this lady? She is the one who is the backbone of these programs. She will be soon be called Dr. Hannah, but she is she knows her grip and then she moves everybody's neck to where to go. She is the one. Thank you, Hannah. Thank you. And then she has linked me to so many esteemed speakers and so many people, and then they are one of the people are there Global Diabetes Initiative, and then she is the one who suggested them, and they are really good. Since she just introduced me, I've spoken to that lady. Since she sent me a friend request on the Facebook, oh gosh, she's too busy. I think she is the one who's just putting me or feeling ashamed of that. What do? You don't do nothing. So thank you, Matilda, or Dr. Matilda. Thank you. And we are gathered here because we recognize that mental health doesn't look the same for everyone. Our backgrounds, our cultures, and our unique lived experiences shape how we understand well-being. Today is about breaking silences, challenging stigmas, and building a community where no one feels that they have to struggle in shadows. We have a packed program today, starting with insights from our distinguished guest speakers and experts with experience. We will be diving into critical questions from the intersection of learning disability and mental health to the specific struggles faced by racial and ethnic minority communities. It is important to note that mental health doesn't discriminate. It impacts people of every race and background. This event is truly for the whole community we see and encounter every day. And we are here to learn the best possible ways to help them. This isn't just a day for listening, it's a day for connection. Whether you are a student, a professional, or someone looking for support, I encourage you to use the question and answer session where Bhavna ji is the best one who will answer to any question. So Bhavna ji is there, she is very keen to, and then she is very knowledgeable. So, and then I have to say good things for them because you need them. So, and Dr. Kishore, he says that he is from Stoke. I don't think so. He is from Stoke. He is from everywhere, wherever I need him. So, Dr. Kishore, when I need it, so I have a group with this mental health, small group, and then where I put my problem that somebody is approaching with this issue, and then they always put hands up and say, we will look after that. So it's very, very good, really, and so please ask these difficult questions. If you want to ask any question to me, ask me simple question and answer where is the exit or where is the toilet. So I will be able to answer them. If there are any difficult, so there are esteemed guests and then there are unlimited people. So you can ask anything. And thank you Community Connections, Black Country Healthcare for making this possible. Hannah, your support and collaboration are highly valuable to me. Nobody's sneezing here, you know that I did tell you. But I think nobody should be sneezing here. Huh? It's bad luck.
No sneeze?
No, it's bad luck, you know. So, but yeah.
Sneeze twice then.
Oh, yeah. So thank you for connecting me with so many inspiring professionals. Their profile and experience are truly impressive, and Matilda is one of them. Let's make today a turning point for our collective well-being. Enjoy the sessions, enjoy the food afterwards, and most importantly, let's support one another. Practical tips for everyday well-being. Before we dive into our first session, I want to take a brief moment to acknowledge that today's topic can sometimes be challenging. Discussions around mental health can easily bring up difficult feelings or memories, whether from our personal lives or from our professional experience working with patients. Please remember to prioritize your well-being, own well-being today. If you feel overwhelmed at any point, feel absolutely free to step out to take a breath. I am here for you throughout the entire day and will be available after the event if you would like to talk. We also have a wonderful team of professionals with us today. So please don't hesitate to reach out to any of them for support if you need it. So I think I will finish that. I just ask people to give me a big round of applause afterwards. Whenever I finish. So that is very important. Otherwise, look, that's important. Thank you. Yes, please. Yes. Yeah, finish now. So yeah, I think I will hand over to Ashish, who will be taking over, or shall I call Dr. Ashish? He has worked hard to achieve that. So yeah, so Ashish is going to be presenting the rest of it, and then I will be jumping anywhere is needed. Thank you.
Thank you, everyone. I'm here just to introduce each of the speakers, as Papa just said. So our first speaker is Councillor Dr. Mona Kuranaji. So she's going to be speaking on mindfulness. So can we first have a slide up?
Yeah.
Yeah. And Dr. Mona, are you?
I'm
ready?
here.
Yeah.
I'm
Do
here.
you wanna- yeah.
I'm here.
Do you wanna- yeah, that's right. Go on. Thank you.
Thank
Round of
you.
applause, please.
Thank you so much. So, firstly, good morning, everyone. A lovely morning today. And before I start, I should say a big round of applause for our dear, respected Atulji. We are very grateful today to have our distinguished guests, lovely participants, and wonderful speakers. So today we are bringing the wonderful energy in this hall of Guru Ravidas Bhavan. So we all are thankful to Atulji for organizing and his team for this event on the mental health and the awareness. Secondly, we are grateful to Surinder Kaurji. Definitely, without her support, we couldn't find this wonderful venue of Guru Ravidas Bhavan. So big round of applause for Surinder. And then we have our community champion, Ramesh ji with us. So for him as well, he deserves a big round of applause. He's from West Midlands Police. So he's always there whenever we need guide, support. He's always there and truly mean it. We have some more guests as well with us. So the topic for today's get together is mental health. And I am very much fascinated with this thought, with this idea, how we can help others. Firstly, we have to help ourselves. And how I can help myself. Because charity begins at home, we heard. So why not, firstly, manage our mental health? Because we all are human, we are living in the society, we are living in the family, and there are so many overwhelming moments. Even though we are experts, but still, our mental health also upset. And then, if we are equipped with some techniques so that we can protect ourselves, and then we can help our family members, and then the friends, the neighborhood, and the society. So today I am giving you a couple of techniques which I use on me, always, and I can say every day. So do you want to learn those techniques? Thank you. I didn't hear actually. Do you want to learn those techniques? Yes. Come on. Do you want to learn those? Yes. Okay. So firstly, in mindfulness, I always preach to connect with yourself. How we can connect with ourselves? Through prayers, we connect with the divine. And through meditation, we connect with our breath and our souls. But with these techniques, we actually connect with our thoughts, our emotions, and whatever we are feeling because of these thoughts and emotions in physically, how this physical symptom can affect our mental health. So mental health means if you are happy, so then your mental health is good. If you are very enthusiastic, your mental health is perfect. But if you don't want to get up in the morning, you are feeling sad, you are feeling low, you don't want to eat, or even if you want to eat, you just eat later. If you have constipation, constipation is connected with your mental health. If you have heartburn, it is acid reflux, and I know that. So whenever there is extreme amount of stress here, that stress travels down here, and then it goes into your gut, and then the whole system gets affected. So there are so many symptoms which you can discuss later on with me as well. I'm here until the lunch will serve. I'll eat the lunch, then I'll go. So I'm here for all your questions, all your queries. Yes. And how we can protect. So if I give you just one word to see mindfully how you're feeling this word inside you. Ready? So one word is, I'm sorry, I'm the first speaker and I'm using this word in the morning, but please don't take it too seriously. Accident. Nobody's smiling. Everybody was smiling, but now everybody stopped smiling. So you know the meaning. And your brain straight away process. It's just a word. And now quickly see where this word is sitting inside your body. Is it here, or it is here? Where it is sitting? Yes, even in my, here. See? So now can you see? Just a fraction of a second and you straight away feel something here, uneasiness. So if we constantly living in any type of negative energy, simple words or situations. So if you are continuously living in the negative situation, or if you are hearing continuously negative words for example, oh, you are not good enough, your siblings are better than you, or your friends are better than you, or this one is better than you. So these type of unhealthy words or unhealthy sentences always demoralize you, lower down your confidence, definitely make you upset. So when you constantly hear something like that, obviously then you don't want to eat, you don't want to talk, you want to cry only. And then there is no solution. But we are here. People like me, we are here to support you. So please contact us. We are here to guide you because we also had similar situation. I also have similar situation. Like I said, I am also a human being living in the family. But how I protect myself? There are days when I'm on the floor. There are days when I want to just cry. Many times it happened, I'm driving and I'm crying. I'm driving and I'm crying because that is my space, so I can cry when I'm alone. Because if I say I'm a public figure, I have to always wear a nice smile. It is okay, that is me. But deeper down, I also have sadness in me. So I always program myself, always remind myself who I am. I always know my purpose. So our purpose is, we are soul. Truly connect with the divine. Find your purpose. And as soon as you will find your purpose, then there is no looking back. And okay, now I'm giving you another word. Let's see how you feel. Holiday on the cruise. Smile and laughter as well. Some diamonds, red roses, movie, picnic, nice dress, shopping. So see, I'm just using the words only. We are not going on the cruise. I'm not giving you tickets for the cruise, but still you're happy. So can you see now how each and every word has a power and how we can diffuse, if we want to diffuse those negative powers on us. Okay, so now very quickly we'll do a mindful breathing technique. This technique is so powerful. As soon as you will start connecting with your breath, you will straight away feel calmness. Okay, so now what we are doing, I will just take few more minutes, and always remember this technique. This is like a religion for us, for our growth, for our existence, for our survival. I can say for our survival. This is a religion for us. So please make yourself comfortable, both the feet flat on the floor. And for this moment, please switch off your phone. Please switch off your phone. I really request, because I don't want anyone to get disturbed by the ringtones. Please quickly switch off. Thank you. And now just bring your focus only on your breath. See how you are breathing in. And breathe out. And now in this moment, we are breathing out from our mouth. Breathing in from the nose. Breathe out from the mouth. In, out. In, out. Keep breathing in, keep breathing in. And if you want to close your eyes, you can close your eyes. Both the feet flat, no cross legs. Both the feet flat, no phone call, no phone, no phone. Feet flat, no cross legs. Yes. Leave all your body weight on this chair. Just sink into this chair. Sink. Drop down your shoulders. Drop down your jaw. Drop down your eyebrows. Both the legs, feet are 100% sinking in this Mother Earth. Just leave your body weight. Imagine you are surrendering on this Mother Earth. And keep breathing in from your nose and breathe out from your mouth. In and out. And now I'm giving you one powerful suggestion in this moment. You can say it loudly or you can chant it under your breath. I believe I have the power to choose peace for myself. And I'm inhaling peace. So take a deep breath in and breathe in peace. And breathe out from your mouth. I am inhaling peace. Breathe out from your mouth. I am inhaling peace. And out. I am relaxed. I am completely relaxed. Each cell in my body is getting the deeper level of calmness in me. I am becoming calmer and calmer. And now I'm absorbing this positive suggestion deeply into my brain like a sponge. And whenever I want to calm myself, I simply have to connect with my breath as an anchor and just say these positive suggestions to me that I have the power to choose peace for myself, and I'm breathing in peace, calmness, and relaxation. So now scan yourself in this moment. Take a pause here and scan yourself how you are feeling in this moment. And whenever you are ready, come back and just rub both the hands together. And now we are generating the healing energies, a calming healing energy, then we both the hands on your face. And feel this calmness on your heart. Keep the hands on your heart as well. How is it?
Good.
Feeling calm? Yes. So now this technique is always with you. Okay, so because I empower all of you to use this technique for calmness and relaxation. Thank you. Do I have 2 minutes more?
No. You will have at the end as a laughter. So I think
Okay, that's right. So thank you so much everyone for listening.
Thank you, Monaji. Every speaker we need to know that we are only 5 to 6 minutes. The only speaker is got more, which is previously agreed with Dr. Kishorji around 15 minutes, and Dr. Bhavnaji about 10 minutes, and Dr. Praveerji about 10 12 minutes. And rest, I think Shilpi was just showing me Hunter on the phone. He said probably 6 to 7 minutes, so around 5 to 6 minutes. So I agree. So I just want to say that some of the stalls behind, which are very good really. One is the Universal Daycare Center, which is please visit them even in the break or after in the food or something. You can see there is a sick woman aid over there, and then they are there, and then Global Diabetes Initiative with us. So it is very good. They are here with their team and then to check their BP, BM, and BMI. So I just ask her, please don't talk about me. So it's just my BMI is I just got it high. And then we have Dr. Alka's skin. And then I don't know, I was so amazed to see that how skin and then mental health she has related. So it's very great. I'm very grateful. We have Dr. Satyavrat Sharma ji. So there will be little talks, and then I will just pass it on to. So I just want to remind that please put your phone on silence, please. It's only me allowed to speak as well as my phone will be ringing. And then rest, please. And then respect the speakers, please. I know we all are. I know it's very difficult for me to say. I can see all the professionals here. Ashish, hello.
Thank you, Monaji. That was very powerful. And we've got a lot of tips, and we know we've learned about the importance of the gut health and knowing how to realize that we're stressed. And the power of words, very, very important there. One word I want to say is applause again for Monaji. Thank you so much. Okay, next up we have Dr. Matilda, who will be speaking on diabetes. We've all heard about diabetes, it's a very demanding condition, but how does it affect each other? How does it affect our lives? Hopefully we get some inspiration and some direction from Dr. Matilda. Thank you.
Good morning, everyone. Good afternoon. Are we happy to be here today? Yes. Good. Today we will be doing screening on diabetes, blood pressure, and your BMI. So join us at the back after this presentation and get your blood sugar level and everything. And if you have the team here, if you just want us to talk on one-to-one, we are quite willing to do that today. Today I'm going to hand you over to my amazing colleague, NHS doctor, Dr. Collins, who is part of the Global Diabetes, to tell you more about diabetes. Thank you.
Thank you.
Good morning.
Good morning.
Please smile. Okay, so while they are trying to do whatever they perfect, I'll be very brief. We hear about diabetes. What is diabetes? So, I have this beautiful image. I hope everyone can see. Now, for this guy to lift up that weight, what do you think he needs? Let us try to name 3 things that this guy needs to lift up that weight. Who can try?
Mental stress.
You know, Chinese parliament. Put up your hand and talk. So that if you are wrong, we know that you are wrong. Yes?
Maybe a trolley or something
Okay.
to,
the science.
Yes, thank you.
Energy and strength.
Thank you.
Mental strength.
Wow! Please clap for him. Okay, all the answers are correct. She spoke of a trolley. This one, she's using wisdom, right? That he spoke of energy. True or false? Yeah. I want to focus on energy. Can we do anything without energy? Can we do anything without energy?
No.
Where does energy come from?
Within us. It is within us.
Okay, one of the places is the food we eat. The food we eat gives us energy. Okay, we all agree on that? Yes. Okay. Now, what is diabetes? So, diabetes is when the food we eat that is supposed to give us energy, that because when we eat food, it enters the blood to give us energy. When you have too much of that sugar inside the blood, that is what we call diabetes. But there is a problem. The sugar is in the blood, but it is not entering the cells. Do you understand what I'm saying? It's like you have money, but you don't have anything to eat. Can your money save you? Yes. So diabetes is somewhat like that. There is sugar in the blood, but in the cells, it's not there. Why is it not there? So it is not there because the thing that is supposed to make the sugar to leave the blood and enter the cells, that they call insulin, has an issue. It is either insulin is not available or it is available but not working well. So we have a problem. We have energy in the blood, but it is not entering the cells. And the bad thing is that as that energy remains in the blood, it starts to cause problems. It starts to cause problems. And that is why it is very important for us to get screened. So, there are different types of diabetes, okay? The first one I said, you can have that sugar in the blood, but you lack insulin to take that sugar from the blood and put it inside the cells. So in that case, the problem is you lack insulin. That's what we call type 1 diabetes. So generally for type 1 diabetes, it is seen in childhood. As the child is growing, the child start manifesting symptoms, and before you want to check, you see that it's because the child lacks insulin. So in that place, insulin is not being produced. But in type 2 diabetes, the insulin is being produced, but it is not working well. Or the quantity that is produced is small. It's small. So you need more insulin in order to make it work well. You understand? There is another class of diabetes called gestational diabetes. It comes with pregnancy, when you become pregnant. You know, when you become pregnant for women, many things happen. You gain weight, you are no more beautiful as before.
More beautiful.
The men asked me to say that. Okay, no, please come back to class. So you can have problems with sugar that comes with pregnancy, but we expect it to go back or to go away after you give birth. But in some people, it does not go away. Then you have some other things that can also cause that sugar in your blood to remain high. There are many other conditions too that can cause that. So, I don't want to give too much book because it's not important for you. No. Okay, please, the previous slide. Okay, this is what I want you to take note. Okay, we are here to learn. These are factors that if you have them, it is important that you should come and check yourself. If in your family Maybe your father had diabetes, your mother had diabetes, your brother has diabetes. It is important that you should come and check yourself for diabetes. If you are in this room and you are more than 40 years of age, thank God, I'm not 40.
Same here.
Same here.
You come and check for diabetes, okay? It is just to screen yourself. It's important. If you are the person that KFC is your best friend, you love oil, come. If you are the person that you cannot walk, you don't exercise, come and screen yourself. It is very, very important. Now, when that diabetes, I said the sugar is high, it will begin to manifest. And these are some of the things that, this is how it can manifest. In some people, you will notice that you are drinking water too much. Because sugar has the capacity to pull water. It's like salt. If you know potato, the chips, when you peel it, you put salt, what will happen? It will pull water. It will pull water. So too with sugar. Sugar will pull water. So when that sugar is high, when you go to pee, since it is pulling water, it will pee too much. And as you lose water, you will see that you become thirsty. So that is why thirst is one of the principal signs of diabetes. So if you notice that you drink water too much, then when you have a cut, it is taking a very long time before it gets healed. You are tired. With time, you cannot see well. You have weight loss, all those things. It can, I'm not saying that it is diabetes, no. It can be a sign of diabetes. So what do you do? Please, we are here to screen. You will not pay a dime. It's free of charge. So if you leave this place and go, and then later on they told you that you have diabetes, will you blame someone?
No.
We are here free of charge. Just come. The only thing is that we'll prick you. Okay, this is just to give some knowledge. That when you come, my sugar level, how is it, you understand? So if you look on the board, now, some of you are here, you have not eaten. Some of you are here, you have eaten. So it is not the same thing. For those who have not eaten, when your sugar is above 126, that is when they say you have diabetes. So when you are not eating for 8 hours or more, we call it fasting diabetes or fasting blood sugar diabetes. If you have eaten, we go up to 200. Well, maybe in the next slide. 200, I'm talking with milligram per deciliter because there are two ways to calculate it. Millimoles per liter and milligram per deciliter. Okay, but don't bother. We will tell you behind it whether it's good or it's not good. Okay? Yeah. Now, I want to focus together with Dr. Mona. I will not come and tell you problem, then I go. I want to tell you solution. Solution. What should we do? What should I do? How should we lift this load? Yes. Number one, be more active. It is very, very important. There is no matter how old you are, please walk. Walk. It is important. I have my classmate here. I saw him today. I'm so happy. And one of the things we learned was the importance of physical exercise in health. Very important. Lose weight. Control your stress. We have learned one technique today. Hypnotherapy. Control your stress. No matter the type of stress, work stress, family stress, marital stress, go for counseling. It's important. Life does not have duplicates. Take care of yourself. Check yourself, blood pressure. Diet, please learn to eat vegetables and fruits. Please. Reduce too much fat, too much meat, too much beef. Reduce it. Vegetables, fruits, quit smoking, less alcohol, get active, you live a healthy life. Of course, with little stress, because stress can. Okay, so here we just have some foods that can help you. You can see fish. It's better to go for fish than meat. It's better to go for nuts and seeds. It's good to go for Greek yogurt. It's good to go for these natural grapes, berries, apples, melon. It's very healthy for the body. It's very healthy. So in conclusion, because I don't want to drag, eat more fruits and vegetables. Let's read together, please. Number 1, eat more fruits and vegetables. Number 2, cut down fat and oil intake. Number 3, get physically active. Number 4, check run. Number 5, number 6.
Dr. Kholi, I think you told me so many problems. I think there is so many problems. There is one solution. You go to that counter and Dr. Matilda, pass it on. Don't keep the problems for yourself. Just pass it on. Thank you, Dr. Matilda. Since I know Dr. Matilda, she is so active on the Facebook. I think she is active on the ground as well. But oh God, she does lot of things. I feel bad when I see her. Because I don't do many things what Dr. Collins is saying. But I do some things. I eat much. And I do fast eating, just food eating quickly, and then I think he did mention about the snacking without food for 8 hours. So he said we can snack. Thank you, Dr. Collins, Dr. Matilda. You see her profile is so good, Dr. Matilda.
Thank you so much, Dr. Collins, Dr. Joseph as well. That's very helpful. Next up, we've got Dr. Satya Sharmaji. That's too much to read. He's got all the achievements he's done. We all know about them.
Not everything.
He's an MD for healthcare in London, and loads of awards, lots of contributions to society. Today, Dr. Sharma wants to talk about organ donation. So, can I invite Dr. Sharma to stage? Thank you.
5 to 7 minutes to 1. George Bernard Shaw was a very witty man, extremely witty man. Somebody asked him to speak for a little bit of time. He said, well, if you want me to speak for 5 to 6 minutes, I have to prepare for 5 to 6 weeks. If you want me to speak for 5 hours, I have to prepare for 5 hours. But if you want me to speak for 5 to 7 days, I'm ready now. Slight variation from the health team. I'm sure the organizers have decided to put something which is not connected deeply with health, but with actually transferring with health. When you come to God's place, Gurdwara, when you come to God's place, Mandir or Masjid, you think about humanity, don't you? And you think about what can we do for human beings. Well, one of the things which you can do is think of organ donation. These are two types, living and after death. Living organ donation means there are only two things you can do. Either you can give one kidney because God has given 2 kidneys and with one kidney you can survive. Or you can give half of your liver. Because with half of liver you can survive and the liver grows in both the recipient as well as the giver. After death, there are lots and lots of things which can be given. You can give heart. Giving heart when you are alive. But all of us do not do it. After death, you can give heart to somebody else who can live with your heart. You can give kidney, so you can give kidney to 2 people. You can give pancreas, You can give liver, again, it can be divided into people sometimes. It's considered that about 8 people can be given life because of us giving something to those people. But if you talk about tissues, such as eyes and skin, tendons, bones, joints, then you can actually, you can't make them live, but you can improve the quality of their life. And the quality of life can be improved in many, many people. We want to have a guess how many people can benefit because of the tissue donation after death. Any guess? 15 is one guess. More? Higher? 20? Higher? 50? Higher?
100.
I wish it was 10,000. But in All Soul, there is a person who is chief of Donor Family Network. This person had a daughter who was 23-year-old, went to America, and unfortunately she had an accident. She was going to die. And they found that she's not going to live, she's not going to make it. We asked your permission for her donation. Husband and wife both said yes. So various things, because she was very young, gut, tendons, bones, joints, eyes, lots of things were given to different people. And she broke the record of 69 people benefiting. She benefited 100 people. 100. Because intestine is very long. And you can chop the pieces of intestine and give it to lots of people. Well, this is absolutely amazing, isn't it? And I'm reminded of the song, Rahe Na Rahe Hum, Main Kya Kahenge, Bande Phool, Bande Khizan. After death, there is only one way you can give, and that is if you give to somebody else. And एक और भी बात है, हींग लगे ना अपने पेड़ी ना, बीच में कहो, मेरे जाने के बाद, मेरे शरीर में जितने भी organs हैं, so either they will be buried or burned. They are not good to anyone. But if I can give life to some people, I think I should be grateful to that God Almighty, who has given me the courage and wisdom to do that. So all of you probably could consider, and what do you have to do? You can actually take a form from hospitals. You can take a form from some health centers do have it. Some general practices also have it, but not all. Fill the form, but my suggestion is that if you have young children or young people in family, ask them to go online. And I've tried it. It takes 30 seconds. All you need to put is organ donation UK, because organ donation is in every country. Organ donation UK, and it will bring you to the right page. So you complete your name, age, sex, etc. And lots of people ask me, will I be sent a card which I can keep? Well, cards vary. Sometimes if they have money, they do send the card, sometimes they don't. But cards are not important. What is important really is that you need to have the will to give, but also please talk to your family. That's important. Because really speaking, if lots of you have heard about presumed consent, I want to spend 1 minute in presumed consent. People think after death the organs will be taken anyway. So what's there to register? That's not true. There are 2 types of presumed consent, soft and hard. Soft is when family is asked. Hard is when family is not asked. In those countries where there is a hard presumed consent like Austria, people say, are the organs property of women? Why? We should have full say. Well, in this country, United Kingdom, we have gone for soft presumed consent, where family will be asked. There are several reasons, time doesn't permit me to go into that. But soft presumed consent means family will be asked. If the family says, yeah, he or she talked about it, but they were not keen, organs will not be taken. If the family says, yes, we talked about it, he or she was happy, then the organs will be taken. After that, it's important. And another fact, if you have 2 eyes, which you don't do, if you have 2 eyes which are donated, 4 people can benefit from those two eyes. Because cornea, the part which is removed, can be sliced and it can be given to 4 people. The techniques are now developing that cornea can be divided into 4 parts, so 8 people will be able to benefit in future. Isn't that amazing? But we all have the capability of doing that after that. I come back to George Bernard's show. He wrote a book, and somebody said, your book costs £10, but I just want to buy 2 words. How much will it cost? He said, well, he's found a word. So he said, hey, you have £2. He said, thank you. And then he took £1 in the pocket and said, 1 word, 1. He said, thanks.
Thank you, Dr. It's a honor to sit by him. It's a very honor to know him. He's such a gentle person, and he's the one who inspired us to. We have raised ourselves to be organ donation many years back when we first came to the country, and then came to know him. It was in Guru Monday. So, and then I think I must tell that one of our Buaji has given anything to the, whatever she was 79, and she has given the skin or everything. I think everything was she was kept for overnight. So it was so wonderful. We feel proud that we are the givers family. And so thank you, Dr. Thank you very much. I think there is a very less word you can say to describe you. Thank you, Dr.
Next up, we have Dr. Shilpi Sharmaji, who is going to talk. We're going to talk more about mental health again. It's so important, and we're going to be talking about understanding autism and ADHD, going beyond labels towards stress. So, Dr. Shilpi Sharma. Okay, sorry.
Good afternoon, everyone. Namaste. Thank you, Mr. Atul, for inviting me to speak here. It's an honor. I'm a chartered psychologist by profession, and I specialize in autism and ADHD assessment and support. As Asians, when we hear the term autism, ADHD, what's the first term that comes to your mind? Anyone?
Sarkawa.
Sorry?
Sarkawa.
Sarkawa. So basically you think that it's deficient or disabled in a way. This is my main message for today. I'm hoping by the end of my 5 minutes, I will try to take only 5 minutes, that one thing gets clear. Autism, ADHD, or any sort of neurodiversity is not a disability. It is just a different way of thinking. Look around yourself. Do any 2 people look the same? We all look different. We all are wearing different clothes. We like different foods. Our personalities are different. Even sexualities are different. When everything is so different, why can't our brains be different? Why do we expect everyone to perceive the world the same way, think the same way, or process emotions the same way? So autism and ADHD, in essence, is simply a different way of perceiving, processing the world. They regulate emotions differently, they feel emotions differently. A very common myth of autism is they don't feel emotions. That is something I hope I can clear today. Autistic people, like anyone else, feel just as much emotion as you do. But feeling emotion and expressing emotion are 2 different things. They may feel emotion, but they don't know how to express it. Or they might over-express. So I will carry on talking while I get the slideshow up. Now, okay, thank you. So what we have got on the slide are just different types of neurodiversity. Neurodiversity in essence simply means different brains, different processing styles. Now, I am a CAMS specialist, children and adolescents mainly, although I have worked across all age groups. I did a PhD in autism in 2006 when rarely anybody talked about it. In Delhi, I did a master's in children with special needs, and my master's dissertation was published. And I wanted to do a PhD, and I could not find a supervisor in Delhi. There was nobody willing to supervise a PhD in autism. So I was very lucky to get a scholarship from University of Strathclyde, and they invited me to do a PhD. So I've been studying autism and ADHD since that time. And since lockdown, of course, I don't know how many people know, there has been such a big wave of neurodiversity assessment and diagnosis. So for the past, I was a university lecturer before lockdown. And after lockdown, I shifted purely to clinical practice because the demand was so much. And specialists in autism were very, very rare. So for the last 6 years, I've diagnosed people from 3 years of age till 80 years of age, trust me. I had 80-year-olds coming for a diagnosis. But often I've noticed something very interesting. I do in-person clinics as well. I've traveled to Oxford, London, different parts of the country. And many a times I have an Indian family walk in. And they somewhat feel relieved when they see an Indian face. And they say, doctor, you understand. Autism, you know, that can't be true. In our culture, we don't diagnose. Bada ho jayega bacha, they will grow out of it. You know, he's just being lazy. He's just being naughty. He's just being difficult. Thoda rude hai, but it doesn't mean that. Dil saaf hai. He's gonna grow out of it. That is a very common Indian perception, Asian perception. And maybe they are right. I'm not saying all behaviors need support. Maybe the child will grow out of it. Maybe they are just being difficult. But sometimes what we see on the outside is a reflection of what they are experiencing inside. For example, if a child in a social gathering is hiding away, if they are putting hands on their ears, or if they don't want to interact, I don't know how many of you have experienced or seen it. Children don't want to go to parties, DJ is too loud for them, people are uncomfortable for them, and parents will say, why are you acting so difficult? Aapko kahan chhod ke jayenge? Aapko to party mein chalna padega saath mein. We think they are being difficult or being lazy, but honestly, it could be the sounds, it could be the lights, it could be the people, it could be the crowd. So right here, if there was an autistic person, the lights, the crowd could be overwhelming for them. And that is a genuine need, which many don't understand. If a child in classes is acting out or having a meltdown at home, often parents say कि बच्चा बहुत difficult act करता है घर पे, meltdowns होते हैं, सुबह school mornings difficult होती हैं, homework नहीं करते. Sometimes it's an overwhelm. They can't, after school they are so tired, they can't cope with it, they can't study. So that is what I'm trying to tell today. Autism and ADHD are not deficiencies or disabilities. They are just different ways of processing the world. And so many times in my clinic, simple adjustments in the way people talk to their children or the way you address them can make a huge difference. Now, I'm not going to go through the slides, all the slides, because when I first spoke to Mr. Atul, I thought it's a 10-minute presentation. So I'm just going to skip the slides for now. And I'm just going to say, autism, there's one message I want to leave today with, and I've got a free webinar because I only had 5 minutes. I thought if we are going to talk about autism ADHD, I'm going to offer a free webinar here. And I've got a sheet of paper with a QR code on it. So if on your phones you scan that QR code, you can register a very simple Google form for 2 minutes. And at end of June, I'm hosting so you can just come online and I can talk more about it. If you're worried about someone, yourself, your child, or even if you have a confidential question, you do not need to get diagnosed. Neurodiversity is not about getting a label. You can get screening, you can just get assessed, understand what is happening, and then just take support, is what I want to tell you. So many a times people think there will be a diagnostic label. That is not the case. You can just get screened and get the support you need. And I hope some of you will sign up for the webinar and I will get to speak to more of you. And that's it, Mr. Atul. I hope I didn't take more than 5 minutes. Thank you.
As soon as you said, Shilpi ji, that there is nobody, two people are safe. There are in the audience, they were very uncomfortable, they were think they are very safe. I know them for very long, I still don't know who is love, who is Kush. And then unki maa hai, and then I still don't know who is Kanta and the other one. So good job she is not here, she is still in Nepal. So it is not a problem with me. But with these children, they are love and Kush, they are look the same. I don't know how do they know that which one is which. Can you stand love and Kush? Okay, so it is very difficult. So yeah. So it is, and that beautiful names, of course, of the one here. Okay, I'll just quickly, before I forget, I won't leave my computer here. I will just speak from here. There are some sponsorship for the event. There's हमारे सुरेश जी कहते हैं कि हर चीज हवा पानी से नहीं चलती, उसमें पैसे डालने पड़ते हैं. So it was quite good. Or my Jitendra Sharma is a very generous person. As soon as my name or my shift goes out that I'm doing something, he would first want to pay or to support. So Jitendra Sharma is 31 pounds. Pankaj Chaudhary ji is there, is 21 pounds. Dr. Shilpi Sharma is 100 pounds. Pradeep Chaudhary ji is 21 pounds. So he's not here as yet. I think he was going to come. And Rajan, he is my friend. I think he should be here with 31 pounds from him. Ranganathan, see, I don't know. Is it? Are you? Oh gosh, Bhavna ji. It's just she's very hidden. 50 pounds from her. Dr. Raman Mittal, 50 pounds. He's sitting here, my brother-in-law. Satan Parivar, Satan Goldfield, he's 101 pounds from it. He's always very helpful, with anything. And their team, they always chasing me that when are you doing, what do you need help with? And Pankaj keep asking me, sir, it's your event and I'm asking you where do you need me? And they were here around just by 10, and then they were helping. So Vipul Bhai Sahab, this is my brother, he's 50 pounds as well, and then I also asked him many other things. So he came at 10 o'clock as well to support me and Bhaviji. Jagdish Sharma is 20 pounds. I don't know how he is doing it. He's in a mental hospital for over a month, but he still wants to be part of everything. Kanta, I think this I mentioned or love to their mom, 3 pounds, 21 pounds. And then Universal Daycare Center, Westbury, their stall is there behind their desk. So they are 50 pounds. They are giving. And then Ashok Puriji is 30 pounds. And Allah Suriji is 10 pounds. Thank you. And I'm moving to 51 pounds from Monaji. I think this is the way, but this is my tactic. I just put their name and then they have to put something. So 51 pounds from Monaji.
Very good tactic.
Thank you.
Blank check दिया है.
Haji.
हमें लगा blank check दिया.
हाँ blank check.
So we've had a lot of talks already, and they've all had the underlying theme of the diversity we have, the ethnic diversity. So Dr. Rohit Sharma is here. He wants to talk about what it was like transitioning from living in India to then coming to the UK. So Dr. Sharma, thank you.
Very good morning. Some of the faces here are very familiar and very famous as well at the same time. So thank you very much for taking time out today for this wonderful event organized by Autism. So this is, I just wanted to talk about things I wish I had known when I left India. Whenever you're leaving India, people are making a very rosy picture of everything will be hunky-dory over there, and then the actual reality struck when you actually land here. I landed in East Ham, by the way. So I wanted my life to be like that, straight line jalebi, but then life actually has its own take on it. So I ended up becoming what it is here. And that is with all of us, whosoever has come to UK, then once they were here, they realized that life is not as straight as they might have wanted it to be. And everybody had their own challenges, so did I. So yeah, so suddenly life changed from, that was a slide by my son, by the way. So he said suddenly the life changed from homemade food to ready-made food. We were going to all these shops to get our frozen paranthas and stuff. I don't know about females, they were still doing some cooking, but men back home were very poor at cooking. Though now I see myself as the next like those. So this was me in 2005 when I landed. And I now consider myself a master chef. Don't ask my wife, she have a different say on that. So, and when you are here, suddenly, I was the first generation who left India. These days, I see a lot of university students are coming here. It wasn't as a big thing at the time. And then, so when we were there for the first time, you realize that you're missing all the milestones. Your family was going to events, shadi, and a lot of other things while we were just here enjoying our life, doing our day-to-day work. So then we learned the ways to enjoying ourselves, making Christmas, Diwali, Holi as part of our lives being here in UK. and it has worked well for all of us, I think. And the community, now that we have this big community here, we all get to meet each other, and it's a blessing. Sometimes you need something, you pick up a phone, you talk to a person, you can do that, and now suddenly you realize we guys, I mean, most of us living in UK meet each other more often than people back home in India. I go to India and see my classmates, they don't meet each other as often as we get to meet each other over a weekend, some event, something is happening. So it's a blessing in a way. And I also tell you, I mean, I've enjoyed more Indian food in UK than I would have back home when I was in Punjab, because we're very then eating just the northern. Over here I get to enjoy a lot of the South Indian, the Gujarati food and everything. So it has developed us as a human being. Yeah, so never compare yourself. On a given day, a tortoise can beat the rabbit. On other days, rabbit will be ahead of you. So do not compare with anybody. Somebody might get successful before you, somebody might get successful after you. Just respect the way we are, and we all have our journeys, and let's stick to that. Yes, I mean, as a doctor, I was blessed. I came with a degree already. So, but there were others who didn't have the degree. They came here to do the degree. There were others who landed without anything. I mean, I work in SMEDIC, and there is a lot of population who don't even have the passports. But they are successful in their own right as well. They don't have to be doctors to be successful. You go to SMEDIC and most of the times there are houses made, all of us. You can't have that done without them. So we have to respect those people, the life they are making. So again, the local, one thing all of us must have realized when we landed, I mean, there were words used which were not part of us, or we were, I mean, I was always confused with this not bad. There were times we've done something, you showed to your supervisor like, not bad. I was like, not bad, is that all? But that actually meant it was very good. So these are the kind of nuances you picked up once you were there, and then now when you see your kids talking, you're like, okay, so maybe this is the part of it, we weren't sure of it, but now we are. Again, I would never compare anybody with a financial success. So there could be some of us who are financially very well off, there are others who are not. There are some who are very well off in the community, there are some who are not in the community. So everybody, again, has their own journey. We had our own. So as long as you're part of the bigger picture, part of the community, it always helps. Well, I have to put that Rohit Sharma there, by the way. So again, so while we are in UK, you need to, I mean, yes, we love cricket, but you also have to learn to love football as well. So that is why we can always play a football with a cricket bat as well if you want. But give it a go. So there is no harm on not sticking to one thing in life that, okay, we do this way and this is the only way. That is a wrong thing, I think. So we all need to learn that, yes, this is our way, but there are other ways. So try to get everything together, and that makes the life more fulfilling. If I could speak to myself back in 2005, these are the kind of things I would say. I don't have to read the whole list. But again, stop comparing yourself would be my biggest thing to anyone who is here now. People who are starting their journey, people who have done their kind of working life and now retired. So everybody has their own say of whatever they have gone through. I feel when we landed, a generation before us had done a lot of hard work, and we just reaped the benefit of that. But that also put a responsibility on all of us as a community to behave in certain ways, so the community after the generation landing after us is not by any chance punished for the actions done by us. So that responsibility is always on us as human beings in the community at large. And we can consider ourselves as the bridge between UK and India, and so that is where I end the talk. I think that didn't take more than 5 minutes.
Sharma was talking about himself when he was talking about cooking. I'm a very good cook. I can make cereals, and sometimes I make 3 colors of toast: white bread, brown bread, and when I burn them, it's black bread. So I can make. So it's. I think you're talking about yourself, isn't it?
खाना बनाने का पता है, पर बातें बनाने में अतुल जी बहुत अच्छे हैं.
Actually, you know me well, I think. Okay. So I think, yeah, Ashish, I will pass it on to you. I think the other thing what the UK didn't tell us, when you're coming here, it's a good country and there is no sun. They didn't tell that this is a sun. This is a country without a sun. But that was another problem. It's a cold, and a British weather also says a British weather. What does that mean? It's a cold weather. Ashish.
Thank you everyone for your attention so far. Next up, we have Dr. Rupa Sharmaji, who will be talking about another cause of stress that often happens in a lot of people. It's going to be about menopause, which affects half of the people in the world, which is a lot. Dr. Sharmaji, if you want to speak.
Nice to meet you all. I think we meet on some sort of, I think I've seen most of the faces on some events. Lovely to see you.
Very might
Is it better?
Yes.
As you know, in my introduction, I think I said that I'm a general practitioner. And I've been working for some time now. And I think over the period, I've sort of seen my patients changing their requests, their issues. And I think eventually I came to a point where I understood, well, you know what? Yes, as a general practitioner, I have been trained to do a lot of things for my patients, in the initial sort of level, help them with their chronic illnesses. But I do have a sort of passion, and that was the women's health, which finally drew me to what I am doing currently. So most of my work is now based in contraception and female health. Navigating through it, so today I think the topic I'm sort of focusing on is menopause and how do we navigate through this, you can say, a journey, a very important journey in a female's life. I think all of us, we are aware what is menopause. I mean, when we think of menopause, I think the brains of males are going to switch off now. Well, that's all about females. No. Menopause is broadly means men. Pause now. It's a time for a female. So still, we need your attention. So here, I think in this slide, what I'm trying to say is that there are two different kind of female groups are broadly identified. There will be some of us who actually do not want to face the reality of menopause, because we are connecting it with, well, that's the end of our reproductive life. We are not going to be as feminine as we were in the earlier life. We are going to have health problems. And maybe this is the end of my life. I should just not focus on me anymore. There's no medication for it. I do not want to medicalize it, of course, but there's nothing for me. But then there's another group who actually feel, well, I feel liberated. There's no harm in acknowledging that this is a part of my life. This is a journey, like all the journeys or all the phases of my life I have gone through. Of course, I'm talking about females here. So, as a female, I think females will connect. There was a transition from being a young girl to actually then having periods and adjusting our lives to it, having new kind of routines, having new kind of regimes to make our life better. Then it came to a point when we had to concern about contraception. That was an important part as well. We couldn't have left without it. And now it's menopause. However, menopause is the least focused time of our lives. When we think, well, actually, I'm not important, but the other things are. But that is where we need to, that is where my second flamingo, just kind of acknowledging what is the problem and then trying to focus. And look at her, how beautiful she is, with the colorful feathers. I think slides are not doing a little bit of justice to my picture which I put on. It was very, very colorful. Okay, symptoms. Like I think most of us, we know the most common symptoms, which is the main reason why they would contact a general practitioner or any sort of doctor about it, which we know will be the hot flushes, night sweat, changes in our sleep, changes in our mood, anxiety. Usually more mood changes will be more reported by the family members than the female herself, because she can't see for her, which is just a natural transition. She's feeling a bit irritable today. So she's not going to tell that this is a problem. For her, this is what she's feeling. However, it's the family who suddenly kind of snap a little bit more. There are lots of relationship breakdowns which happen during this time. So you need to realize this is not just the female going through it. It's mainly the hormones are also not helping her. Her intolerance, just a medical fact here, the tolerance she's had for all throughout her life was because of the progesterone supporting her. When that goes down or kind of fluctuates, it doesn't help her. Or in fact the family around. She's fine, I think, within her right. So more than the normal sort of symptoms you would be having, it's mainly the long-term health benefits which the female should realize. It's not just a lack in, it's not just the mood changes, heart pressures, or the physical symptoms she's experiencing. Unfortunately, going through the menopause means her estrogen levels, which is one of the hormones which we have carried all our life and it has made us look very feminine, is now fluctuating. Unfortunately, lacking it does make our bones very weak, so we are more prone to get osteopenia, osteoporosis, or weaker bones in simpler terms. We are more prone now, after the age of 50, which is the kind of average age 51 of menopause, to get heart-related problems. We are protected by estrogens in our earlier lives. And then, of course, the other local sort of problems, which is our genital health and as well. I think few of my sort of speakers, of course, they have, no, in fact most of them, they have covered about how to live a life which is happy, healthy, and how to maintain it as a way of life rather than looking at it as a disease or a problem. It's a similar thing in menopause. It's nothing different. You look at your physical health, you stay physically active, you eat a balanced diet, you prioritize sleep and other things, and manage stress. Stress is a very big part of menopause, perimenopause, postmenopause. You cannot ignore it. It has to be acknowledged, not just it's my life events, not just that my life disappointments, not just my family stress. I have possibly lost my parents in that last decade. I've lost my siblings. Main problems. I've got health problems. So it's a very hard time for a female to go through the stress. And hence having mindfulness, having yoga techniques there, having relaxation techniques, it's all very, very important. Now, NHS would offer cognitive behavior therapies, but they are, of course, as such with all the NHS sort of pressures, that is available very kind of, in few places, but there are therapies available purely focusing on menopause-related symptoms. What are the support and treatment options? So if you are somebody like me, I usually start with the non-hormonal options or things we can do ourselves. So you've looked at your lifestyle, you've thought, okay, well, I need to have a better life, I need to have an active life, let me give that a first go. You've done that. Some symptoms are still not going away. What do you do then? Then you come to the doctors. Yeah, and then we of course guide, and that's of course, I'll advise all of you to please have that sort of thought, have that conversation in your head, and have you reached that stage, or rather, why should I leave it to the last stage when I'm, at the end of my tether? Why don't I make that appointment today to go and speak to somebody who knows about what they're talking and just seek their help? So there are tablets, or there is medication rather, I'll use the word, which is not hormonal. If you think, well, I have not gone, on with hormones all my life and I don't want to take it, and there are medication which is not hormonal, but it would still help with your menopausal symptoms, a lot of them. Now, there will be some females who, unfortunately, either after trying the hormonal, the non-hormonal method, they still would like to consider, but they are not getting benefit. The next step will be using hormone therapy. There is a mixed press about hormone therapy, whether it's safe for everyone. I would say, in my experience, and generally not just my experience, as per evidence says, it is safe. It's a safe medication for most of the females. However, there is a caveat, as always. However, there is a group of females who are unfortunately not suitable, or rather, HRT or hormonal replacement therapy is not suitable for them. There are certain conditions which clearly have to be spoken to with your sort of general practitioner, and they can go through why they think that this is not suitable for you. And if I could just broadly tell you, these will be the females who unfortunately have had certain form of cancers, mainly your breast cancer or ovarian cancer, who unfortunately are not suitable because hormonal replacement therapy can trigger off the cancers again. But otherwise, I think most of the females will be fine. It's a good medication, hormonal replacement therapy, because not just it's helping you with your symptoms, it is actually helping your symptoms which you're not experiencing now. So it's helping your bone health, it's helping your heart, it's doing a lot of other things which you possibly would not like to mention, like lack of libido, like vaginal dryness. That's not commonly talked about. menopause symptoms, we mainly talk about the hot flashes, night sweats, and we leave it there. There are a lot of other things which females will not talk about. Of course, the mental health, HRT, there was a time 10 years ago where when a perimenopausal female will come with mood swings. Of course, there will be life stressors. And the first thing, as a GP, I'm going to talk about myself, I probably would have offered is anti-anxiety medication, possibly antidepressants as well. Now, going through all the evidence and of course further training, now I feel, and when I see a female, I'm not late to propose a HRT because I know that probably could be a fix to their lot of problems they are experiencing. So I think, and just like me, a lot of the general practitioners would have changed their practice because there is a lot of evidence that these females are suffering, and unfortunately, antidepressants is not just the only answer for them. Yeah, sorry, the benefits and risks of it. So as I said, look, I'm not going to make a broad term that it's safe medication for everybody. There will be some people who can't take it, but that's a discussion which is individual based. Everybody needs to make that effort to go and speak to your doctor so that they can go through, they can look at your history and then decide whether that will be something good for you. And clearly there's various forms of it, not going into detail. So just basic myths and facts about it. Menopause lasts over a year? No, it can last for up to 10 years and even more. So be prepared for it. HRT is unsafe for everyone? No, we know that it's quite a safe medication. Nothing can be done about the symptoms. You can do everything. You can do a lot about your symptoms. And support and treatments are available. So I think today, just one takeaway message for you, that menopause is not a disease. It's a natural transition, like you've had transitions all throughout your life. So just embrace it, acknowledge it. It's gonna happen. If you're going through it now, acknowledge it, go and seek help. If you think, well, I'm not now, but maybe few years, it's not harmful to just have a little bit more of knowledge. For males and for children, just think about the females around you. Do you think, if you think they're suffering, or they may be, there's a change in their personality and suddenly they have become a lot different from they used to be, this could be a reason. Just kind of encourage them to seek some medical help about it. That's it. That's it.
थैंक यू डॉक्टर रूपा शर्मा। मैं पीछे गया लास्ट में पूछने के लिए आपको आवाज़ आ रही है, तो डॉक्टर रोहित बोलते हैं कि पत्नी की आवाज़ है, मेरे को बिना बोले में सुनती है, कहते हैं हर समय सुनाई देती है। तो वो ठीक है डॉक्टर साहब, मैं समझता हूँ इसको, मेरी पत्नी को स्टेज नहीं है अभी, पर मैं फिर भी उनकी बात सुन रही है। तो थैंक यू डॉक्टर, थैंक यू। And I got another 30 pounds from somebody. I said they don't name them. Somebody sitting in the second row. 30 pounds from them. Thank you.
Thank you, Dr. Sharmaji. So, trying to be fair in our speeches today, we've had menopause talk, and Dr. Neurodiversity, who's a introduction behind me, will be talking about prostate cancer, who's also brought a model, very interesting. Okay, Dr.
Talk about the prostate cancer. I think we'll start by knowing what a prostate gland is, because most of the people don't know what the prostate gland is. It's the male anatomy. When I knew I was talking about it, I had to order it. So this is the bladder, the urinary bladder. So the kidneys bring urine to the bladder for storage until you're ready to pass it. And this is the gland which sits. It's actually two parts, just like a walnut, half of a walnut. So it sits there, just around the urethra, which passes through. And that's why you get urinary symptoms as a symptom of prostate gland. It has nothing to do with urinary symptoms. It is a reproductive organ, part of reproductive organ, which actually produces semen as the sperms are being produced by the other parts of the body. Okay. So what happens? It's a knobbly, just like a walnut gland, and when it grows beyond a certain size, and when that may be a benign or cancerous, but then it goes beyond a certain size, and the GP can, or your doctor can, look from your back passage, feel it, assess the size, assess the feel of it, and tell you whether to worry about it or not. Nowadays, it depends on the blood test for it. If you want to take a look,
I will be showing around after the set. So
you can just keep passing it on.
Okay,
if you like.
just pass it on.
So it's more common in men over 50. There's been a lot of debate in the social media about whether we should, or news about whether we should ask for the screening of the prostate. I don't know whether you are aware of it, but the screening is only through a blood test, which is called prostate PSA blood test. But then that PSA can be raised in a number of other conditions, benign conditions like heavy exercise or just a water infection. So that's why it's not a perfect tool, and the screening will cause more anxiety in many people than it's worth it. It is usually found early because eventually it will start pressing on the urethra, on the tube which takes the urine from the bladder because it grows around it. So it's going to start pressing on it, and when the man starts to pass urine, he will feel the urge to pass urine, but it will take time. We call it hesitation time to start the stream. Then it comes in dribs and drabs, so that's dribbling. And then there is a post-micturition dribble, which means when you feel that you're finished, and then a few drops come, and that may spoil your health and things. The good part is that most people can be cured of it, and up to 25% of people will never need any treatment for it, because it's a very slow-growing cancer. Specialists are usually very happy to just keep an eye on it, and they said, depending on how your initial follow-up shows the growth pattern to be, they may just want to monitor it, give a certain limit for you, and then when the blood test crosses that level, then you go back and get treatment. Otherwise, you don't need it. So the risk factors are old age, obesity, and if you have a family history of it. Obesity and age are the risk factor for most of the cancers anyway. Age you can't do much about, you should be lucky. Obesity you can. So if you are more active, more fit, you can reduce the risk. These are overall signs and symptoms. I gave you a brief synopsis just early in introduction. Another key symptom you can get is blood in the urine. Again, that's not typical and only limited to prostate cancer, but if you see blood from anywhere where it shouldn't be, you should report it to your doctor anyway. As I said, the first will be rectal examination, so from back passage. It's uncomfortable, shouldn't be painful. Then there is a blood test. There are some limits of the blood test. If you're beyond that limit, age-related limits, then the doctor will refer you further. And then when you go to the specialist, you may get further scans, CT scan, MRI scan, PET scans, depending on whether the prostate has spread, and then you will get biopsy to ascertain whether it's definitely what type of cancer is it, or is it even cancer. So again, it doesn't always need treatment, it can just be monitored, and treatment is quite successful. It includes surgery, chemotherapy, radiotherapy. Apart from keeping a healthy lifestyle, you can't really prevent it. And as I said, 25% of the prostate cancers don't need treating. It's a rosy picture. Of course, there are the other end of people where prostate can spread and it can become disastrous. Most of the cancers in the prostate, because it's a capsulated gland, if it's found early, it can be closed up. That's it. Any questions?
I don't think so I've ever said Dr. Neeru or Dr. Neeru Agarwal or Dr. Agarwal. We always call her Neeruji. She is so approachable, and then she's coming a little bit late because she was doing some seva in the mandir and then preparing the food with the whole the family, and then for the food for the homeless, I think. that is due to both hormones, several conditions. And their whole family is so devoted with all these tasks of any kind of a thing. So thank you, Neeruji, you still you said that you will be coming. So yeah, next.
Next up, we have Dr. Chowraji, and we're going to go back to talking about mental health. It's kind of the pop in, pop out, pop in, pop out. Dr. Chowraji. Yeah.
Hello, everybody. Namaste. It will be a hard act for me to follow after Monaji, Satyavratji, Silpaji, Rupaji, Guruji, and Matilda. Where is the Matilda?
Matilda.
Oh my God. It will be a very difficult act for me to follow. And my topic is depression. But the idea is for me, as a psychiatrist, when I see people, I'm seeing them when they are gone into the illness stage. So not this low-level depression, low-level anxiety. Arey thoda dukhi ho gaya, arey mera, sorry. Yeah. So as a doctor, I see people with depression, and then I treat them with depression, make a diagnosis, treat them with medicines, and the depression is in different stages: mild, moderate, severe with psychotic symptoms, admit them under the Mental Health Act. So my day-to-day life is very different. But within the community, within talking to people, I have to sort of point out and tell them, okay, you just check out and keep yourself mentally well. I can borrow one of your slides and turn around and turn it on its head and say, if you did all these things, you will feel better in yourself. Like address your obesity level, address your activity levels, have a connection, like what we are doing today. Like we are marking ourselves and saying, okay, I need to connect this person with this person. And Dr. Sharma, who came from abroad, Rohit Sharma, sorry, I didn't mention your name. Like the way you said, your struggles become inspirational stories. So that's what it is, that's the connection. So we realize that हम अकेले अपने दुख में नहीं बैठ सकते हैं. We are not so important that we need to give importance to only to our dukh. Our dukh in comparisons to others' dukh is manageable. So then you turn around and look for inspiration, do the right things, and then avoid the wrong things, as always said, in terms of things that affect your health, starting from smoking, alcohol, drugs, gambling, pathological addictions. Moving from it, try to have adaptive lifestyle, change a little thing, even a little thing will bring big dividends. And Dr. Satyavratji said, have a purpose, have something. You've taken this human life, try to do something even better beyond your life on earth. So go and, like what Atulji does, bring everybody together, bring all the intelligence together. We look at each other and get that inspiration. So these are all the things on the side where you're thinking, keep your mental health well, don't go into depression. My other topic was about anxiety. Anxiety and depression are bhai-behen. दोनों हाथ पकड़ के चल जाते हैं. So when you are very anxious, you can become depressed. When you are depressed, you are anxious. And then when you talk about anxiety, it's such a horrible thing. You wouldn't want, as I informed you, I treat people at the very severe end. So at the severe end, if a person is depressed, they are, I wouldn't wish even for anybody else, because just for a minute think you're going to an interview. Are you going to have a talk? Are you going to do a driving lesson? Are you going to do an exam? You're anxious at that time. Take that anxiety and multiply it by 100 times. That is the anxiety for no reason. बिना reason. अभी ठीक है, अभी आप अतुल जी ने बुलाया तो ठीक है, सैटरडे जल्दी आने का, लेट आएगा तो अपसेट हो जाएंगे और नाम अच्छा रहेगा. So that is a different anxiety. You need that. You need anxiety, otherwise you will not even motivate yourself. You won't even push yourself. So anxiety, and depression go hand in hand. Same thing with anxiety, have a purpose, do meditation, do yoga, regulate your diet, eat healthy, not indulgence, not get into diabetes. See, these are all the ways. Like whatever, any of whatever ideas and whatever advice you got from the previous speakers, just remember them. Even if you follow a little of it, you are helping yourself to stay away from anxiety and depression. And that's all I have to say. And everybody have a great time, and thank you, Atuji, for bringing the community together, binding us together.
You know, Bhavna ji is such a great person. This is a thanks to Sudarshan ji, who introduced to both of you, Kishore ji and Bhavna ji. Wonderful. When he contacted me, I was hosting one of the events. He came to me, he was in a very simple dress and then I thought, he said, are you a mental health talking about? I said, I'm a mental health nurse. So, okay, why don't you talk about this and that? And then he introduced, and he was a person, and then I can't even find him. So wherever, but he has got so many other issues he's doing. So thank you, Bhavna ji. You are always very inspirational. Thank you.
So next up, we have Dr. Kishorji, who we just were brilliantly introduced, who will be adding on to all the information we can talk about so far, to talk about stress and psychotherapy, philosophy and spirituality.
Good afternoon, friends. First of all, I would like to thank the organizers, especially Atulji, for organizing this wonderful event. And as you can see, the topic of my talk is how to manage everyday stress. Now, I use the word everyday stress, which means that it can be applied to everyone, not just people who have got anxiety or depression. And I would like to point out here, about 100 years ago, more than 100 years ago, Sigmund Freud said that he can help people with anxiety, depression, clinical suffering, but he has no remedy for the suffering of an average person. He can convert clinical suffering into normal human suffering, but he has no solution for normal human suffering. But this program addresses the issue of normal human suffering as well, because it has elements of spirituality and philosophy alongside psychotherapy. Yes, sir. Now, these are the various ways in which we help clients: education, mentoring, therapy, counseling. But this program that I have developed is a 6-session stress management program. It's none of these, although it has bits of each of everything, all the categories. But it's more than just therapy. And I'll explain how this is different from therapy. And I'll give you the example of debriefing. You know, in military settings, when soldiers are on the combat, on the front lines, when they come back to the base station, they have a debriefing session. And debriefing means that you narrate your experiences, traumatic experiences, and with a group of people who have gone through similar experience, and it helps them. But we have found that some soldiers don't like it. For them, it's like double whammy. They have been traumatized on the front line, and then you ask them to narrate the traumatic experience. They don't want to do that. They just want to rely on sleep or do something else to feel better. Do you know what the difference is? The first group know how to manage their stress. So when they are describing their problems, the traumatic experiences are processed and they feel better. Whereas the second group, they don't know how to process their emotions. They don't know how to manage their stress. So it's very important that if this group of people can be explained how to process stress before they start doing the debriefing. So that is why we have found same thing with therapy as well. Some patients don't want to talk about their problems. They say, you know, what is the point in talking about my problems? They are just there to listen, it's not going to help. So this program helps clients who are not yet ready for therapy. They don't want to talk about their problems. So it's preparing them for therapy. So it's not, this 6-session program is not exactly therapy, but it has elements of counseling, it has elements of education, it has elements of therapy, and more than that, philosophy and spirituality as well. So these are the 6 therapy approaches that I have integrated into this 6-session model. It has elements of CBT, psychoanalysis, interpersonal therapy, existential philosophy, biofeedback treatment. Biofeedback treatment is where you use electronic gadgets, devices to manage your stress, and I talk about it a little later. So these are the 6 sessions. First session is on what causes stress. Second session is how to understand the mind. And I have tried to explain the mind in terms of different models, psychoanalytic model, CBT model, and other kind of mindfulness, therapy model. And third is non-identification with your own thoughts and feelings. Now, non-identification I borrowed from Eastern philosophy, Indian thinking. How to not identify with your own negative thoughts and emotions and how to overcome it. Fourth session is on biofeedback and psychophysiology of stress. How stress affects our body and how can you deal with stress at the body level, the heart level, at the brain level, and what is biofeedback treatment. Session 5 is on spiritual philosophy, existential philosophy. So existentialism is a branch of philosophy that helps us deal with stress better. And finally, the 6th session is on spirituality. What is inner peace? How is inner peace different from general happiness? And how to achieve inner peace? It is better if I can see it. So first of all, what is stress? How do we define stress? So there are 3 definitions. One is stress is a stimulus that impinges on you. This is borrowed from physics, because a metal piece, pressure comes from outside and then it breaks. So it's a model from stress comes from outside. Second model is that stress is an emotional reaction to something happening. 2 people experience same situation, one breaks down, the other one doesn't break down. So it's emotional reaction. And the third is this interaction between the 2. So I have chosen the second definition, that stress is an emotional reaction to something that is happening. Now, if you analyze deeply, emotional reaction will happen only when you have made a judgment. If you have not made a judgment, there will not be an emotional reaction. To give an example, you walk into a room which is dimly lit and there is a snake there. But you see the snake as a piece of rope, so there is no stress. On the other hand, there is a piece of rope, but you see that piece of rope as a snake, and you may have an anxiety episode. So your mind is not reacting to what is actually out there, but what judgment your mind has made. And if you can control your judgment, you can control your stress, you can control your emotions, isn't it? So that is one cause of stress. Second cause of stress is impermanence. That everything is temporary, nothing stays forever. Separation and loss are inevitable, and that's constantly eating us from inside. Now it's very strange that the fact that everything is temporary causes stress, but the same thought can be used to undo stress as well, to become immune to stress. If you constantly live with this thought that everything is temporary, nothing is permanent, nothing goes to stay forever, before the actual thing happens, then you can cope with the situation better. So that's why I give little dots to people to stick all around in their house and everywhere, to their car dashboard or their bathroom mirror or their wallet. And whenever they see the dot, they have to say to themselves, the situation I am in is temporary, the thoughts going through my mind are temporary, the emotions in my heart are temporary. And that actually helps, because when you actually have that situation, your mind is prepared for it, like anticipation relief. Third is uncertainties of human life. Human life is uncertain. Anything can happen to anybody, and there's no guarantee of good life to anybody. You may be the Prime Minister of the country, you may be the celebrity. There's no guarantee that future will be good for you. And that creates anxiety, that creates stress. And many people cope with this differently, like OCD patients, anxiety patients, they develop all the rituals and everything. to become certain about things. So that's another cause of stress. Then identification with our thoughts and feelings. We tend to identify with people, things, ideas, philosophy, and whenever there is disagreement, whenever there is issue, we get stressed. I identify with my son, I identify with my brother. If my brother misbehaves, I feel upset. But if somebody else's brother misbehaves, I don't feel upset. Why? Because I identify with this person. If there was no identification, there is no stress at all. So this is again Indian philosophy that you should not identify with anybody, anything. It doesn't mean you don't love them. You do love them. But identification should not be there. Okay, next. Now, coming back to first cause, how to be less judgmental. If we have discussed that judgments cause problems, how to be less judgmental? So there are 5 things you can keep in mind. First is all judgments are relative, not absolute. If I say to myself, I'm rich, but then compared to people, I'm not that rich. If I say I'm stupid, compared to people, I'm not that stupid. Yeah. If I say I'm intelligent, compared to people, I'm not that intelligent. If I say I'm stupid, compared to people, I'm not that stupid. So you can go on applying to health and whatever. So when you say this judgment is relative, depends who I'm comparing myself with, you can tone down your judgment. Second is, I haven't got the full information yet. My judgments are based on information in front of me. If more information is available, I will be the first person to change my judgment. If you have that attitude, then you will not be very rigid about your judgment. Once a journalist asked Mahatma Gandhi, can you please tell me your opinion on this? He said, yes, I can tell you, but by the time you publish, I may have changed my opinion. Can you see the logic there? So if you see the tentative, then it helps you. Third is you can't look into the future. You can't look into the future. With hindsight, things might look different. That will help you tone down the judgment. Fourth is move from global to specific judgments. Global to specific judgments. The mind has a tendency to make global judgments all the time. Good, bad, right, wrong, beautiful, ugly, intelligent, stupid. The reality lies somewhere in between, in the grey zone. So how to move close to the reality? So if you break down global judgments into specific judgments, my family don't understand me. Okay, that's a global judgment. In what way? In what way they understand you? 1, 2, 3, 4, 5. In what way they don't understand you? 1, 2, 3, 4, 5. I haven't got enough money. That's a global judgment. But for what? You have enough money to go to Paris on a flight, you can buy a new pair of shoes. You may not have enough money to buy a mansion or yacht. So that also helps. Finally, in psychology, opposites can be true. In mathematics, physics, 2 plus 2 is 4, it can't be 6, it can't be 8. But in psychology, opposites can be true. Let me give you some examples. I mean, we live in a friendly world, and this is not a friendly world. Both statements are true. There is ultimate meaning to human life. There is no ultimate meaning to human life. Both statements are true. Your family members understand you, they don't understand you. Both statements are true. I can give you concrete examples. I had a client, he was in his 50s, and his father was in a care home, and he used to visit him once a month or once in 2 months. One day doctors told him that your father doesn't have much to live, maybe few weeks you are looking at. So he started going more often, twice a week, thrice a week. He started spending more time. Instead of 1 hour, 2 hours, he spent 3, 4 hours. His wife said, there's no need to go that often because your father has got dementia, he's not benefiting from your visits. And housework is being neglected, children are missing piano lessons, football lessons. But he said, but I want to go, I want to be with my father. So what if my father is not benefiting? It helps me to be with him. Can you see, both can be right? A girl, 19, 20-year-old girl wants to go clubbing, and mother says she's not mature in the way of the world, she should not go. And she says, but I'm 20, all my mates are going, it's Friday night, what do you want to do? Sit at home and do nothing, or watch television. Can you see, both can be right? So what people do, and I'm not telling you something new here, you already know, this side the arguments are stronger, you look at that and do that, isn't it? I'm not telling you something different here, you already know it. But the difference that this thinking can make, you will not rubbish the opposite viewpoint. You will understand that this person is also right and I am also right. That happens in marital situations. If husband knows I am 100% right, if wife is disagreeing or saying opposite things, she has to be wrong and he has right to get angry. But maybe the wife is also right. She is seeing things from a female perspective and he is seeing from a male perspective. Both can be right. So this helps with stress management. Next. Second session is on understanding the mind, how the mind works, how the emotions are produced, where they are stored in the unconscious mind, how they are utilized, what is the analytic concept of mind, conscious mind and unconscious mind. And that helps people understand that symptoms are coming because things are coming up from the unconscious mind. You are reliving a past emotion. So I call them ghost emotions. So it's important to make a distinction between real emotion and ghost emotion. Because real emotion requires an action on your part. You have to act. Whereas ghost emotion, no action is required. It's like the safety alarm going off, fire alarm going off. If it is real alarm, then you have to take an action to get to the building. But if it is false alarm, you have to do nothing. But you must know that it's a false alarm. In the same way, if you can know that this is ghost emotion, it has to be dealt with differently compared to the real emotion. And that helps you deal with stress better. Then we talk about this analytic concept, observing self and experiencing self. The mind has two parts to it. Some people have very strong experiencing self and they suffer more. Others have very strong observing self, they suffer less. So the technique here is all about how to make your observing self stronger so that you remain in control all the time. Then we talk about sympathetic parasympathetic nervous system, how it helps. Focusness. Third is about non-identification. That you don't identify with your own thoughts. Don't identify with your own emotions. In English language, there is a very good phrase, this thought has crossed my mind. Crossed my mind means it has come from outside, it's staying for a while, maybe be gone. It's like air in this room. Does this air belong to this room? If you're talking about this second, yes. Come back after 10 minutes, it's gone. So, if something stays with you for a long period of time, that is the real you. But if something that comes and goes, how can that be the real you? Now you are wearing a blue jacket, but that's not the real you. Tomorrow you'll be wearing something else. The glasses you are wearing, maybe after a few months, few years, look something else. But the shape of your nose, the color of your eyes is the real you. So that's the you. Same thing with emotions. If in the morning you are depressed, in the afternoon you are happy, how can that be the real you? So if you don't identify with these thoughts and emotions, you can deal with them better. I don't know the details here. So, in Byron Katie and Eckhart Tolle, how much time have you got? You just give me 5 minutes. Let me know 5 minutes, sir. So, I mean, if I have another 5 minutes, I can explain more on these things. Byron Katie is still alive. She's an American self-help guru. She became severely depressed, suicidal. She wanted to die. She stopped eating. She would not come out of her bedroom. And then she thought to herself, why am I like this? The answer that came to her mind, because you believe in every thought that comes to your mind. Thought came to my mind, my husband doesn't love me, I believe in the thought. Thought came to my mind, my children don't respect me, I believe in the thought. Thought came to my mind, I haven't got enough money for old age, my parents don't understand me, my friends don't care about me. But then she said, I don't have to believe in these thoughts. She stopped believing in all these thoughts, she got herself out of it. So then she developed a program called The Works, which is on YouTube. Second is Eckhart Tolle. Eckhart Tolle is a Canadian psychologist, spiritual guru in Canada. He was sitting on a bench in a park in London. Thought came to his mind, I can't live with myself. But then he thought to himself, what am I saying? I can't live with myself. Does that mean there are two entities there? Then he said, oh yes, there are two entities. One is my mind, which is intolerable, and the other one is my spirit, my inner consciousness, my soul, my ruh, my atma, whatever you want to call it. That can't tolerate with this person I have become. And then he developed programs about non-identification. Non-identification is also kind of a very Indian concept, but you will find lots of Western religions have talked about non-identification. How to apply it is that you say, this is not my real self, this is not my real self. Whenever you feel depressed, whenever you feel anxious, whenever you get angry, say to yourself, this is not my real self, this is not my real self, and that helps you. Fourth session is psychophysiology, how you can deal with stress at the body level. Psychophysiology and biofeedback means that you are using an external device which tells you what is happening to you, heart rate monitor, respiratory rate monitor, brain wave monitoring, and you can see for yourself, and then you do something to yourself so that you can control it. That, in simple terms, like a mirror to your mind, isn't it? A friend of mine, I connected him to EMG, electromyography, in the muscle, and I said, your muscle tension is high in the muscle. He said, oh, how much is my reading? I said, 550 units. So he said, what is normal? I said, 5. I told him, I will give you 10 minutes, do something, and I'll come back again. I gave no instructions to him. I said, 50 is yours, 50 MB, and yours is 50, and normal is 5. I came back after 20 minutes, and he was able to drop to 15, but just doing something like that. So that is biofeedback. So this can be used at two levels, at the heart level and at the brain level. There are techniques by which you can change your heart rate variability, increase heart rate variability, and that is supposed to help you deal with stress better. Second is at the brain level. When people get stressed, they find that the alpha wave drop, and if they can't sleep, delta wave drop. So there are techniques by which, using lights and sounds, it's called entrainment devices. The principle is entrainment, borrowed from physics. I won't know the details here. But through those equipments, devices, you can change your brainwave pattern so that you are more resilient with stress. Next. Fifth is existential therapy. How existential psychotherapy helps. Because science has existed only for last 150 years. What did people do to manage their stress? Humanity has survived for 10,000 years. What did our forefathers do to manage their stress? They relied on spirituality and philosophy. And how does philosophy help? Philosophy, different ways it can help. So, first of all, they talk about free will, that there is free will, if there is free will, then you are responsible for making choices. Who you are today is a result of choices you made 5 years ago, 10 years ago, 20 years ago. If you don't like it, start making different choices now, and you'll see that you will be a different person. And they talk about, what they say is that don't shirk away from the difficult questions, death and meaning in life and purpose in life and remaining in relationships, goals of life, all those things. Thinking about death is a taboo. So people don't want to talk about death because they think, what's the point in thinking about death? You can't shift it, but you'll end up feeling unhappy and miserable. But that's not true with existentialism. They say that you can desensitize yourself to death if you allow these thoughts of death to come into your mind. You don't have to invite them. But if the thought is coming, it's only natural, it's normal for a human being to think about one's own death and death of your relatives. So you get desensitized to it. So that is what they say about it. Then they talk about ontological and ontic suffering. They say there are two types of suffering. One is ontological, it means inevitable, unavoidable, you can do nothing about it. And there is ontological anxiety, depression, fear, anger, everything. And ontic means there is a remedy for it, you can do something about it. Problem is that people see ontic as ontological and ontological as ontic. Something that cannot be shifted, and they spend all their energy to get rid of it. It's not possible. Sometimes it is remediable, but then you are doing nothing because you accept it as normal human condition. So lonely, these things that come, there is loneliness, how to deal with loneliness, how to deal with existential angst, they call it angst or depression. So once you know that this relates to the basic human condition which everybody has to suffer, you will not fight too much with that. And authenticity is also a biggie. They say that if you can become more authentic. Authentic means genuine, real. What is inside is outside. You are not telling lies. You are not creating false friends, and that helps you deal with stress better. In the short term, it may increase your stress, but in the long run, it will help you. Then meaning in relationships, there are lots of talk about how to understand relationships, and there are different ways of understanding relationships. What basically existentialism says is that we underestimate the importance of relationships. If there is any difficulty in relationship, we cut ourselves off from the person, we just walk away, we become indifferent, not realizing that relationships run much deeper than the problems you see in them. So you must try to, you may walk away, but you can't get a person out of your mind after 20, 30 years, you are still thinking about the person. So, the other way of explaining is that default setting, relationships. Now, I'll give you two examples. One is, you know what default setting is, what is normal, what is natural. And I'll give you two examples and you tell me which one is applicable here. One is togetherness. There must be togetherness in relationship. If there is no togetherness, that's not normal, isn't it? Second is separateness. That we were born alone, we will die alone, nobody will go with us. Every relationship has its boundaries. Beyond those boundaries, we are all alone. And so, which one will you say is the default setting? Which is a normal next, separateness or togetherness? Who is saying togetherness? Raise your hands. And separateness? So it's equal, isn't it?
I think there's somewhere in between.
Somewhere in between both? Yeah. Yeah.
It depends upon situations.
Situations.
On life.
Yeah.
How you proceed.
Yeah. We'll look at the pros and cons of both situations. If you see togetherness as a default setting, problem is that whenever there is togetherness, you take it for granted that it's normal, it should have been there, what's the big deal? But if togetherness is not there, it will hurt you very badly. Because something that should have been there in relationship is missing from the relationship. This is not normal, and your mind will react badly to it. On the other hand, if you see separateness as a default setting, that we were born alone, we will die alone, every relationship is. When you say separateness, it doesn't mean true love doesn't exist. There is true love, but the true love also has its boundaries. If you cross that boundary, then true love will also come to an end. So if you see separateness as a default setting, whenever you see somebody, a loved one, behaving in a selfish manner, it will not hurt you. You will understand that, okay, this person has to look after his or her needs first, and then they will look after our needs, isn't it? It won't hurt you. But when you see love and affection and care, that will make you a happy one, isn't it? That's like a boom sitting on top of your normal relationship. So if you see separateness as a default setting, you are making yourself immune to interpersonal stress. That's what Indian philosophy teaches us, that we are all alone, we will die alone. It doesn't mean that we don't have capacity to love, we should not love people. We should love people the way everybody else does. I won't go into the short time, I won't go into the other aspects of relationships. And finally, spirituality. We explain as to how inner peace is different from normal happiness, and what are the avenues to inner peace. In how to describe it. In old days we used to have this concept of psychic, body, mind and soul. But when the science came, people thought you can't study soul scientifically, so they threw away the concept of soul. But whatever the functions of soul were, are being described in terms of the mind. So I will not use the word soul, but I will use the word inner consciousness as a scientist. Inner consciousness. Now, that inner consciousness is different from your mind or intellect. Indian philosophy is full of that your mind, you are not the mind, you are separate from the mind, and you can use the mind the way you use the computer. So, that inner consciousness is such that no anxiety can touch it, no fear can touch it, no depression can touch it. It's beyond anxiety, depression, fear, old age, even death. No fire can burn it, no sword can cut it. That part of your inner self, and there is no suffering there. There is no suffering there. If you connect with that inner consciousness, all your suffering comes to an end. Isn't it beautiful? If you know how to connect to that. And that happens at night, not when you are dreaming. When you are dreaming, your mind is still active. But when you are in deep sleep, mind also goes silent, and then you connect with that inner consciousness, and all suffering ends that way, and body starts being really charging. So how to understand this consciousness? It's like a light, or it's like a mirror. Now mirror has no thoughts there. Mirror has no emotions. Mirror doesn't make any judgment that you are looking beautiful or you are not looking beautiful, your hair is not looking good. But it tells you everything you need to know. That inner consciousness is like a light in this room. Now light is not telling you that you must turn right, you must go left, you must stand up now, you must go out of the door. Nothing. But it helps you at every step, in making decisions at every step. So that inner consciousness is like the light in the room, it's like the mirror, it's like the electricity in all these gadgets. Yeah. So if you have that concept, then it helps you step outside suffering easily. And then we discuss spiritual values, how they can help: forgiveness, friendly feelings, surrender, solitude, detachment, transcendence, and scientifically how you can explain how these values can be helpful to you in stress management. Thank you. I have circulated a book in the room here. It's not to promote this book. This book is available free of charge for anybody. They can just download the digital version of it from the website.
There are so many things Dr. Kishore does, and like he said, he was saying that can you put Stoke-on-Trent? Because that's not, you're not from Stoke-on-Trent, you are from everywhere, wherever you are, your thoughts, your values, and you do a lot of events, and then we have managed to join, me and Abhikya, we came on a couple of things, couple of events, so it was wonderful. And then I agree with everything that people have talked about. Dr. Bhavna talked about anxiety and anxious, and then stress. I always say that stress is infectious. As soon as you are stressed, you will make somebody stress. Yeah, this is make a married couple. But so I will go for these next ones. And then we only got, I think Ashish told me that we got only less time, so we got many speakers. So we want to finish on, we want to predict, and then everybody, let me, your name is on here. So thank you. Yeah.
So, Dr. Lakshmi Budwaji. Oh. Yeah.
That's okay.
Sorry. She's here to talk.
First of all, very good afternoon, Namaste, Sat Sri Akal, and Assalamualaikum as well. And so, after hearing Dr. Kishorji, honestly, it was such an amazing, mesmerizing, whatever talk. I have nothing else to add.
All of the above.
All of the above, yes. Can you hear me? Hello? Yes. So, one thing I will say. Okay, thank you.
जैसे सनी देओल ने किया था ना नलका उखाड़ दिया।
ओके, नलका उखाड़ दूँगी, ठीक है। मैं माइक को पकड़ के घुमा दूँगी, ठीक है। तो I'll be saying few things in English and also in Hindi and Punjabi as well I can use, because I can see people from different background, and English might not or Hindi might not be kind of more acceptable. So I'll be starting with Bollywood. How many of you have watched Tanvi the Great movie recently? Oh yes. So okay. So Tanvi the Great, it's a very new movie, recent movie, and it talks about autism spectrum disorder in general. But today I'm going to, I know 5 minutes is nothing I've spent 10 years of my life to study and practice in NHS for the last 30 years and doing this, working on this topic. So basically, this autism spectrum in Asian community is very not much talked about and kind of really hidden, because when I was growing up in India, कोई भी ऑटिस्टिक पर्सन देखते थे तो बोलता था ये सेंटली है, और अब क्या है, बिकॉज जो पर्सन है वो आइसोलेशन में रह रहा है और अपने आप में इंजॉय कर रहा है, और जो क्लासिकल ऑटिज्म है they have got very like saintly qualities. They're very honest, very direct, very straightforward, and उनको जो thoughts और actions जो सोचते हैं वही बोलते हैं. जैसे उनका dissonance जो है ना, the dissonance between thoughts and expression is very less. So they have, in like Western world, they say they have got no filter. So this is, so in autism in Asian communities, it's even in professional, like amongst professional, it's not very well received, not very well accepted, and it's a lot of denial is there, and families don't want to, even very highly educated people don't want to accept that their child or they themselves are experiencing, are being on spectrum disorder. So in terms of, they have only some of them have got very special qualities, but a lot of them, when it's combined with learning difficulties, it can be very devastating for the child or for the grown-up. Or if it's combined with communication difficulties, it can pose additional problems. So, but early identification is must. So, what autism actually is? How many have heard of this concept, the word? So basically, it's a lifelong neurodevelopmental difference in how a person communicates, relates to others, and experiences the sensory world. In terms of experiencing the sensory world, they can be, they can be either very tactile or they can be very avoidant. They can be going towards light or can be very avoidant, or they can be loving all the stimulations, noises, or they can want to avoid all these. So that's why it's a spectrum. Spectrum, not two autistic people are alike, and support needs range from minimal to substantial. So depending on their needs, the support is being provided. In all, has anybody seen Rain Man? Yes, they have got exceptional, some of them, not all of them, have got very exceptional memory, photogenic memory, and they can just see things and recall immediately. So next, I know it's such a short time, and this topic in itself needs a full day. So there's social communication. They kind of, as I was saying previously, they kind of struggle to socially communicate. They don't use filters. They'll say straight, direct. They'll say things. Or some people might see it's very rude, that somebody is very rude. But basically, they will say what they feel. I wish if people want to understand autism spectrum disorder, Tanvi the Great is a lovely movie. And the old movies are like Chadda, something like, there's another in which Amir Khan has acted. Tare Zameen Ke Nahi, Baal Singh Chadda, that's another movie. So, it's a hidden gap, not a smaller population. Basically, reported autism rates are lower across. They say it doesn't exist in Asian communities, but it's all hidden because the tools are not appropriate to assess them. So the evidence points to under-identification, delayed diagnosis, and not a lower occurrence of autism, especially like under 4 and 7. Asian children are diagnosed. This is a typical age for diagnosis, but there are fewer services. So diagnosis, there's a disparity. Again, Asian is 48, Hispanic 77, Black 83, White 100. The other thing is when culture and diagnostic criteria don't align. Has anybody watched Mrs. Chatterjee and Norway? So those kids were they were on spectrum. But because that Mrs. Chatterjee was living in Norway and the services didn't understand how autism in different cultures present. And in my clinic as well, when I see Asian families, they present in a very different way. But the white population don't seem to understand. And they've got this myth that Asian families support each other too much. So these are kind of the harmony and conformity, defense to authority, muted expression, bilingual presentation. These are like fitting in is very important in our culture. Being able to fit in. Because वो कहेंगे बड़ा वो तो बहुत ही संस्कारी बच्चा है ना बड़ा ओबे करता हैगा है ना गल सुनता हैगा है ना but that is at what cost? Their individuality is being compromised. Second is defines deference to authority, quiet compliance is accepted in our community. Then muted expressions, जितना चुप रहेगा उतना ही better है ना? And somebody expresses their views, that's not thought to be good behaved child. And bilingual, having double languages. Some of our kids have 3-4 languages, and so that also kind of acts as a hindrance in diagnosis. Where the stigma comes from? Again, I was saying tradition, expectation, the model, minority myth. Saving face, इज्जत बहुत important है हमारे culture में. इज्जत, honor, है ना? And it serves purpose in some aspects, not everywhere. And limited autism literacy understanding is very less as well. How stigma is felt? If, like my child is on spectrum, then what happens? I'll be apologizing for the child, for their disruptive behavior, their climbing here and there, or the child is being quiet. So I'll be apologizing rather than talking to the teacher, because this is how this aligns with my values. And concealing the diagnosis, shame. I know a lot of families, Asian families, having worked in this field for the last 30 years, that how even professionals, they shy away. And that's very sad. Withdrawing from public life and then carrying shame quietly. And then sometimes pushing back, challenging unfair labels, advocating for their child, and educating those around them, refusing to hide. Next. These are the 4 barriers. Logistics, NHS waiting list is long. Some of the autism services has been, that's why I left NHS after 30 years. We have lost funding. There is no funding. There is 2 years waiting list. And private, it's ethically, I feel very, it doesn't go with my values. Charging £2,000 from the families for, diagnosis. And then in the school, there is not much of services as well. So I hope so this government does something, but that's a topic for another day. So NHS is long, there's a long waiting list. Providers, few culturally competent people are there to diagnose. There's no autism literacy, cultural stigma, and the takeaway is to help people, to help children there, the system, the providers, and the information around families are not there often. What culturally responsive service looks like. Community education. Maybe, Atulji, what this year has brought so many, professionals under one umbrella. Maybe if there's an appetite in the community, this could be provided free of service. And what Dr. Sharma Shilpi is going to arrange that webinar, that's so amazing. So these kind of culturally competent services are needed. We can move to the next one. I know I'm aware of the time. So families as cultural innovators, families are, they should not be passive recipient of the service. They should be actively involving the service provision. What to carry? The gap is, there's a gap, and we need to recognize that gap and how to manage that gap. Because as I was mentioning, and people are aware that NHS services are, funding is declining, especially for ASD services. So maybe there's if we, all of us coordinate, our efforts and our intellect and our resources and our energies, maybe under community, we can provide these valuable services to the families, because ASD, the condition, the kids, if they are diagnosed early, they can contribute significantly to the society's, welfare, and they can flourish as young children as well. Thank you so much. Any questions, please? Thank you to the organizers. Thank you.
Thank you. Ashish, can you go for the next one?
She is kindly representing certain parivar, which is a very good, I again mentioned before, doing a lot of work. And inside UK, they do a lot of work. Certain parivar, we have the one charity. They do a lot of things with the children, and they're amazing to see them. Okay, Simran.
Have you noticed most of the doctors are working?
Huh?
Three charts. Oh, there's 2 charts, 3 charts.
Hello everyone, my name's Simran. I'm a GP registrar with a passion for women's health. I used to work in obstetrics and gynecology, and now I'm in GP. I know we've already had some talks about menopause today from some very senior colleagues, but I just thought I'd touch about mental health and menopause. I'm really passionate about this because it's not very widely talked about, and menopause affects every single woman, and therefore also can affect their families as well. So I think it's really important that we come together in communities like this and discuss this openly. So, like was mentioned before, perimenopause and menopause is a natural life stage. So menopause is when a woman has not had a period for a year, and the stage before this is perimenopause. And this can last for many years and start as early as late 30s, early 40s. So it can affect such a considerable amount of a woman's life. It occurs because of hormonal changes, and these lead to symptoms. And the physical symptoms of menopause are really well known. So we think of hot flushes, joint pains, things like that come to mind when we think of menopause. But the mental health aspect is as well known or talked about, and it can be just as significant and have a huge impact on a woman and their family's lives. So just going to briefly talk about the symptoms. So what can these mental health symptoms look like? So anxiety, so worrying about things, overthinking, that can be really common. Changes in mood as well, so feeling low, not feeling your usual self, not having that motivation to go out and do the things that you would normally enjoy. Irritability can be a really common one, so just becoming a bit more snappy, not having that tolerance anymore to deal with things, and mood swings as well. I often hear from women and their families that one minute they feel absolutely fine, and the next minute it's just like flicking a switch. They feel not like themselves at all, and that can be really difficult to manage, a really horrible thing to go through as well. Brain fog is something that I've come across, and when I first started working I was like, what is brain fog? What is that term? But this clouding of someone's kind of memory, their functioning, their concentration. Sometimes I have women say, I open up a tab to search something and I've just gone out of my brain what I'm going to search. Or they've been working with people for years and years and years, and they go into work and they can't even remember their name. So it just has such a huge impact. And all these things can lead to a reduced confidence as well, and that can impact their relationships, impact their work. So it can have such a huge, significant impact on lots of kind of different sources of their life. There are also other things that impact mental well-being. So poor sleep affects almost 2/3 of women going through perimenopause and menopause. And we often know after one night's sleep, I feel really awful, and it really affects my day-to-day, how I function and how I am as a person. I can definitely be a bit more snappy. But imagine that over weeks and months, it's going to have such a build-up on how they're feeling. Physical symptoms as well can have a huge impact on your mental health. If you're dealing with hot flushes, waterworks, lots of different changes, that's going to have an impact on your mental health. And also caring responsibilities. So perimenopause and menopause often affects women in a time of their life where they've got a lot of caring responsibilities. So not only for children who might be becoming teenagers, but also for the older generation as well. So looking after their parents, and all of that stress also has a huge impact on mental health too. And we also mentioned before about relationship change during this time. There might be that sense of intimacy which has been lost through lack of libido, and that can also add to mental health stress and pressures. So what can we do to help this? I know it's been talked about a lot today, but lifestyle changes are really important. So having that time for yourself to get some regular exercise, going for a walk. One of my colleagues says to people, get a dog, which can be a huge responsibility, but at least then every day you're going out, getting that fresh air, going for walks. And strength training is really important in menopause as well, not only for your mental health, but for your physical health. So whether that's doing some low impact weights and resistance bands, that's going to keep your muscle mass good, help protect your bones from deteriorating, and also be really important for your longer term health in the future to reduce the risk of frailty and keeping that independence too. Healthy diet is also really important too. So making sure you've got enough protein in your diet, really important, especially if you're a vegetarian as well, and that can have a really good impact on your mental health. And good sleep habits can have a really important impact too. So getting in a good routine, having some time to wind down before you're going to sleep, not spending too much time on your phone, which I am definitely guilty of, scrolling on before going to sleep. That is not good for your sleep. So trying to get in a good routine and making sure it's a good environment, so you're not having distractions, you're not bringing your work into the bedroom, you're trying to get rid of screens, a nice calm, cool environment to sleep in. Social support is also really important. So like I said, menopause, mental health, we don't talk about it very much between ourselves. I did a talk recently to 40-year-olds and they said, our mums didn't talk about this, our aunties didn't talk about this. So I really encourage you, it's really great that we're here today to talk about these subjects and talk about it to your peers, because everybody will go through the menopause and 90% of women will get symptoms. So people are going through this, and being open with them can build that community together, support, and being there for one another as well. And then talking to your GP and other healthcare professionals. So we're here to help, we can provide a listening ear, we can help understand what you're going through. I've had people come to me saying, I think I've got dementia because I just can't remember things, and it's actually the menopause. So if you're struggling with something, please do come, and hopefully you'll have a listening ear and some help and support and guidance. And then we spoke about medication earlier as well. So there's medication that can help with mental health, and there's medication that can help with the hormones, and sometimes we use them in combination as well. And a lot of these medications are very safe. You might not need them for long periods of time, but they might just help you through this transition of your life. And talking therapies as well. So again, that's been touched on today. So things like cognitive behavioural therapy, where you talk to a professional, it helps rewire your thinking patterns. And unfortunately, there's not many services just linked to menopause, but there's services like Birmingham Healthy Minds and other local services that can help with this as well. So it's just a very brief talk today, but like I said, many women experience these psychological mental health impact of menopause, and it's really important that we're aware of the support available, and we talk about it in especially minority communities. There's also a lot of online support, so there's online communities and forums, and there's this website called Women's Health Concern, and they've got a really good fact sheet about emotional wellbeing in menopause too. So have a look online, and hopefully you might get some tips from there as well.
Thank you, sir. Thank you. I'm not taking mic anymore, you know. I think when your son says you must speak, then I do.
I think there is not much to say about him. I met her in her wedding. She was looking very different, very beautiful. She is still beautiful. Thank you, Sim, for coming. Thank you, Rameshji. Okay, our Rameshji after that. Parveerji. Parveerji, I think whatever his qualification I will say, but I will probably say that he is friend of ours. So this is the most beautiful thing we have. Thank you, Parveerji.
There is something wrong in the mind. But yes, you're right. For those who are wondering, ये क्यों शर्मा ज़्यादा नहीं हो गए? So there is a Sharma organization, and we are slowly wanting to take over the city. We have. I'm sure you have reached a stage where इतना सारा ज्ञान पेल दिया गया है कि anything more that is said is not going to get inside you. So I will, being aware of that, I will keep it very, very brief. What I want to do is to just give you a brief overview of dementia and just talk about local issues. So how common is it, how to recognize it, how to treat it, and how to prevent it. But I do it within minutes, don't worry. So I don't want to bore you about the numbers, but just so that you know, 1 in 14 people who are over 65 will develop dementia as you age towards 100. So if you take 100 65-year-olds in a room, about 1 person, about 5 people of those will have dementia. So in a room full of 65-year-olds, 5 of them will have dementia. But if you take 80 and 85-year-olds, 100 of them in the room, about 20 will have dementia. So you see, as we age, the prevalence, the incidence of dementia increases. I remember somebody asked my professor, "Professor, how do we prevent dementia?" So the professor kept quiet for a minute and then said, "Well, I got only one solution for it: stop aging." Let's move on. Move on again. So we are spending 23 billion in the year, and dementia is now the leading cause of death in this country. Move on. Let me just tell you what is dementia. So dementia is not just memory problems, and dementia is more than just memory problems, because memory problems can have different causes. But dementia actually is a term that is used when more than just memory is involved. So if you have got problems with, say, speech, recognizing speech and making yourself understood. So both the recognition, the understanding, as well as the expression of speech, judgment, thinking abstract, all of that indicates that a lot of part of the brain is involved, and which is what indicates dementia. But then there's another important feature for somebody who has dementia, which is the deficits that you see at point A should progress on to point B. So at point B, in 6 months, 1 year, 2 years time, there should be a progressive change. So that's a crucial part of the feature of dementia. Now, these are different ways in which dementias can express or can be seen. More. What are the causes of dementia? We have got very common causes of depression and medication that can make one forgetful or make one a bit dull and disoriented. So when somebody comes to me with problems of memory, we always rule out if there is depression that can explain if there are any vitamin deficiencies or any problems in the brain, such as brain tumors or brain infections that can point towards a problem in the brain functioning. And those need to be ruled out before you diagnose dementia. So the common dementias are Alzheimer's and vascular. In Alzheimer's dementia, the problem is that there's a deposition of toxic material within the cells, and there is a problem with the connections between cell and cell. So what we find, just more there are pictures. So yeah, this is another way to just impress upon you how a cell which is normal, a normal brain cell is like a tree. It's like a very growing and healthy tree with lots of branches. But the brain cell on the other side is a very it looks like a very shriveled tree, and that's how the brain cells become in people who have dementia, who develop dementia eventually. This is a slide just to demonstrate how the toxic material is accumulating in the cells, thereby killing the cells. Let's also just go back on that. So this is another feature of Alzheimer's dementia, where we find that the interconnections between cells, which are possible by tentacles, are disrupted because of some structural protein abnormalities within the interconnections. Therefore, the brain cells do not talk to each other as well as at other times, and that's what creates the features of dementia. We are familiar with vascular dementia, as in the Asian community, we have the greater prevalence of vascular dementia. Essentially, vascular dementia comes from either multiple strokes that have happened in the brain, or sometimes even a single stroke at a crucial part of the brain can cause this condition to appear. So, just so that you know, the brain that looks where there are those white patches are essentially parts of the brain that have died. And these white patches on the other side you're going to look at it as the white has to be read as black. So all the white that you see on the brain, in the brain are actually empty spaces, because all the cells have died and the cavities have appeared. So that's what's happening in the brain. The brain cells are dying and the brain is shrinking in size. So the question comes on how do you treat dementia? There are now medications available. You have read about the medications in the press. But let me talk about the older ones that have been available so far. There were medications, 4 different types of medications. They are started by specialist memory clinics. So the important thing is for you to actually take yourself to the GP, who then refers you to the memory clinic for an assessment. A diagnosis is made and medication is started. The medications are effective if they are started early. The best effect of the medication is in the early part of dementia. When the dementia has progressed to moderate and severe stages, then the effect of the medications is that much less. You will ask me, or you will be wondering about the newer medications, and these medications are not available freely at present, but they have been approved for use. They have not been agreed by the NICE to be available in this country. That stage will soon come. At present, there are trials going on all over the country, and it's possible to show your interest and join those trials, and then thereby be prescribed those medications as part of the research trial. So, very few words about dementia prevention, because if you simply follow the advice of all the speakers before me, you'll be fine. My main message would be to make sure that you look after your heart. If you look after your heart, you're looking after your brain. For example, diabetes, smoking, drinking, all of these, and healthy eating, all of these can affect your heart health. And if your heart is good, your brain is good. Thank you.
थैंक यू परवीर जी। अब मेरे को ये नहीं समझ में आ रहा, जो ये आ रहे हैं सभी स्पीकर्स वो ये बोल रहे हैं कि भी स्मोकिंग छोड़ दो और शराब छोड़ दो, और जिन्होंने पीते नहीं है वो पहले शुरू करके छोड़े। तो ओके रमेश जी, जस्ट ए फ्यू वर्ड्स एंड देन सीता जी एंड नेक्स्ट।
Good afternoon. I think it looks like I might be the finale. There were more speeches, and I'll certainly keep mine very, very short. First of all, I think we should give a big hand of applaud to all these experts that have stood up here and given an impact presentation. So please give. And secondly, can I thank Atulji for organising this very, very special event with the support from his son Ashish, our future in medical advance. So big hand of applaud for Ashish. And thank you to the Guru Ravidas Bhavan and the committee for always engaging with the community and allowing lots of events to take place as very, very important to the community that we are all in and serving. I'm not an expert in this field, as you can see. I'm still part of the West Midlands Police. So really, as far as the mental health awareness, I think it's very, very important that we all take this very, very serious in the sense that there are many people in the community who are or may be suffering, they may be silently suffering, and they're not aware of all these facilities and where to go for help. So therefore, I think with the experts that have stood here today and presenting what they can do, but I think we need to know is where to find it and how we can relay this into the community to make sure these people in our diverse community take advantage of this. So I think one of those is, as has been mentioned, is maybe through our network, our community, our Gurdwara Mandir Masjid. I think it's very important that we take our messages back to these places so that these facilities, where they are and how we can reach them. I know Dr. Bhavna, she mentioned earlier on alcohol, drugs, stress and depression. Now really, this is where sometimes the police get involved, where they don't really want to get involved because they're not that expert in mental health. But we do have the Mental Health Act, which then is that all these issues that have been mentioned this morning, they end up into domestic issues, and some of it ends up in crime. So to try and avoid this, and I have personally dealt with a few of these in my time, so therefore I think that we all try and support this particular type of network and all these experts that have been here today, and to try and obviously funding is a big issue. So if there's no funding, some of these things might not be available. So we try and support them in the funding and support them in their organising and our messages out to the community and assist our diverse community in many angles. And finally, if I may, I'd like to plug in that making the difference. You can only make the difference if you are on the inside. A lot of people criticize from the outside. Now, the West Midlands Police is one of the partners in the community partnerships. At the moment, we have 6 routes available on our website for people to come forward and join the police service. We need people to come in from our communities because they're the ones that can actually an input into awareness of cultures, faith and support. So please, if you know anybody that is interested, go onto our website, West Midlands Police, and register your interest. I am part of the positive action team there and will support you to try and be successful in achieving that. Once again, Atulji, thank you so much. Thank you everybody. Thank you very much.
Thank you, Rameshji. You have thanked everybody. We would like to thank you. You always try to come and support all the events. So it is thank you to make your time and then come here. Thank you. डॉक्टर सीता जी आज मैं सोचा था कि कैसे बुलाएंगे, इतना पावन नाम है और फिर उसके आगे भी रत्न लगा है। और ये वैसे इन्होंने बोला था कि सभी शर्मा है, क्या ये पुलिस वाला भी शर्मा ही निकला।
और मैं उनको बोलने वाली थी कि अतुल जी आप लाखों में एक हो, but then I thought कि आप you will be upset because we are more than 1 billion country, isn't it? And so if I am saying somebody लाखों में एक, then it is very offensive. That means you're average, you know. If you're called once and one in a lakh, लाखों में एक is average for us. So we are at the end of the more or less. The food is not here, guys. So you are my captive audience, okay? So I thought what we'll do is we'll do a quiz about sleep. Can you put just this way, okay? My first question is, how much time, how many years of our life do we spend in sleep? Our average lifespan now is around 90, okay? And women, we are supposed to have died at 40. That's what evolution made. So it's very nice to hear we are experiencing menopause. We have to celebrate that because we were supposed to produce kids and die at 40. That's what nature intended. So जो भी उसके बाद है is big bonus. So question is, how many years do we spend in sleep?
30 years.
30 years, correct. Very good. So the next one is, do we die without sleep? Yes. Do we die if we don't sleep?
Yes.
What's your evidence?
Yes.
We don't die, okay? We don't die, one answer. We die without sleep?
Yes. Yes.
What's your evidence? We're still alive. No, what is your evidence? You have to give me some evidence. Why do we die?
Evidence is I slept last night, before last night, and I'm still alive.
You're still alive. You didn't sleep for 2 days and you're still alive.
No, I slept. I said I slept.
So yes, the answer is we die without sleep. The reason being is they did an experiment where they kept some very healthy rats without sleeping, without deprived them of sleep. There was nothing wrong with them and they died. That's the only one evidence. People, this is interesting. We spent 50 years of our life sleeping and we know very little about sleep. Oh yes. Okay, so that's the thing. So people didn't even know whether one would die without sleep. People conducted experiments, they went and locked themselves up in caves for 40 days, 50 days, but the sleep would overcome. So the only evidence we have to date is 2 things. One was that experiment which cannot be repeated because it was so cruel and the rats all died, and when they did a post-mortem, nothing was wrong with them. The second evidence we have is that there is a genetic condition called familial insomnia, in which the people are healthy, but eventually they die. It's an extremely rare genetic condition. Okay? The third question, do all animals sleep? Yeah.
No. Don't know.
Who said no? Why?
I read before, there's a few animals that don't sleep. I don't have the proper answer for you.
Okay.
Well, but I think animals do sleep because man is an animal. Do all animals sleep? Yes. Yes.
So all animals sleep. So when animals are hibernating, do they sleep? Yes.
Yes. I think so.
In hibernation they sleep. What about birds? They're flying. Do they sleep?
Yes.
How do you know? They're flying. Do they sleep?
24 hours, 7 days, 365 days in a year.
So the brains have 2 brains. One brain is sleeping while one brain is active. So they do sleep, but it's a divided sleep. Okay? So even when they're flying. So that's kind of interesting. Next slide. Okay, so this is a question. Every one of you sleep, average sleep. How many times do you toss and turn? So कितने बार करवटें बदलते हो in regular night sleep? Depend नहीं, average बताइए.
It all depends, he's right.
Average बताइए.
Next to you, it all depends on the
Average 50, okay.
33.
Who said 33? 6, 10, 33, or which numbers?
Every 10 minutes.
So 30 to 40 times is the correct answer. Average sleep 30 to 40 times. Okay, अभी तक खाना नहीं आया, so you're my captive audience. What is a common word used in sleep talking? Common word in all languages. Whether you are speaking French, Russian, or word, not 2 words, word. Sorry?
Mummy, she said.
इतना अच्छा वाला नहीं हम in all languages home is French में क्या बोलेंगे? What is
No. I'm going to say no.
Who said no? Yeah, that's the correct one. So the most common word in all languages is no. Okay, so the next. So there are more questions if you want, but I'm just mindful of the time. So I have got a lot of sleep questions if you're interested. So this picture, can anyone guess what that picture is of?
Moonwalk.
No.
First footprints.
Sorry, first footprints of?
Discovered of a man, of a girl, a woman, and a child.
Not just woman and child. Man, woman, and a child. So if you see the big step is a man. The second one, woman's steps are the 6. So it's hunched. She's carrying a baby on her hip. So it's a man, woman. He's probably holding the woman on, and there's a baby on the hip. The reason this picture is iconic is the first very picture of an example of a family. Wow. And why it's so important is all the things that we discussed today, it affects one person in the family, it affects the whole family. Okay, so that's why it's such a poignant picture. It's the first example of family. So we don't live in isolation, but our problems affect our family. So the duty for us is to look after ourselves well first, so that we look after our family. So the next slide. So why is sleep important? So sleep is important for several reasons. It's restorative. It hoovers the brain of all the toxic chemicals. It kind of the good growth hormone. It's kind of secreted in sleep. Your daytime functioning improves. So all the chemicals, all the chemicals that are all active in bhavna, patience, all the serotonins, the dopamines, everything, they are moderated. So the mood improves. And it's also, reprocesses all your thought. Learning actually is consolidated. The memory, all the memory is kind of consolidated when you're sleeping. And there's so much evidence that US loses $1 trillion because people haven't slept and they're having accidents. Just a question, there's a lot of women in the room. So how many women, what percentage of women are unable to work because their children don't sleep? We've got 2 child camps people here, autism people, she's left. 100%? They both have left, I think. So how many, what percentage of women are unable to work? So there's a community loss because, and especially in Asian women who we come and we don't have a network of support. What is the percentage? Any ideas? 50%. Sorry? 50. 50 is a bit high. 15 is a bit low. 30%. So that's quite a loss to the working age, this thing. So that's why sleep is incredibly important. Yeah? And we need to be thinking about sleep. Next slide. So this next slide. So these are the most important. Aapne sab suna hoga about the circadian or daily rhythm, and this is how it is. How our wakefulness thing goes. Next slide. So the key to all of this is there's a tiny gland in the brain it's pea-sized, it's called pineal gland, it secretes melatonin, and that's what sets the day-night cycle. So previously it was thought that the circadian rhythm or the day-night cycle is informed by the brain. But since then they have found that it's there in all the organs to some extent, and each organ has its day-night rhythm. And Madam Ji has told this morning, and this is so important, all the rhythms have to be synchronized with each other for you to have a very holistic and restful experience. So this is how the melatonin, in line with the melatonin, this is how you would feel. Next slide. So we talked about, Kishorji talked about NRM sleep, and he mentioned it about deep sleep. And we have 5 stages. We have 4 stages of NRM sleep and 1 stage of REM sleep. Sleep cycle is 90 minutes. And when you are having autism, ADHD, your sleep is disrupted. Because every 90 minutes, you're waking up and the environment has changed. A child has gone to bed, then it was noisy, wakes up, it's quiet, and waking up at 90 minutes is a survival technique. This is because there was danger all around us, so a human being had to wake up and get into a light sleep so that he could sense whether it was safe back and then go back to sleep. So it's really essential, to think about the environmental factors. Next, this thing. So, when should you be worried? You're not sleeping 1 or 2 days, should you be worried? So, insomnia is when, there are 3 types of links to the sleep. One is difficulty falling asleep, one is staying asleep, or the quality, or waking up but not feeling restored from your sleep. So, that defines a good quality sleep is you fall within how many minutes? 15 to 20 minutes you should fall asleep, and for the next 20 minutes you'll be in a light sleep, and after that you go into a deep sleep, and then the last stage is the REM sleep. That's when the dreaming, the movements happen. After that you wake up a little bit, but then again you go back to sleep. So that's the sleep cycle. So it has to be, if you're not sleeping 3 days a week, or your quality of sleep is impaired, and it affects your daytime functioning, and this problem is present for more than 3 months, and it's not explained by any other mental health condition like depression. Depression, anxiety, mental health and sleep are very linked. So difficulties in sleep exacerbate the mental health problems, and equally mental health problems may lead to difficulty in sleep. So you said the bhai behan, these are like judwa things, okay? And there are a lot of research, if you don't sleep for some time, you will start hallucinating and all that. That is quite common. So this is the burden, we have got few GPs. So 69% of people presenting to primary care, they present with insomnia. So that's a big, we've got several GPs and retired GPs here. And out of 50%, they're occasional, and 19% have chronic insomnia. So that's a big burden on the society. So, and we have talked about sleep and menopause in quite good detail today. So the just next slide. So health risk, I just want to focus on that. Mental health, cardiovascular, type 2 diabetes and obesity. So if you're not sleeping, these are the things that can get worse. With hypertension, there was an interesting study done recently where just by increasing the people with blood pressure an hour more to sleep, they got no change in medication, showed a decrease in the blood pressure monitoring level. So sleep is so restorative in various conditions. So just the next thing. And we talked about it, this is self-explanatory. Next slide please. So in children especially, sleep leads to problems with attention, concentration, learning difficulties, chronic sleep problems on their own, and we're not talking about kids with neurodiversity. and then it leads to hyperactivity and impulsivity. This is on its own. That's why when all these neurodevelopmental spectrum assessments are being done, really important to track a child's sleep. You get this pages and pages of assessment, but sleep has not been mentioned, or a good sleep history has not been taken. So, and it's bi-directional. So, what about teenagers? Should they be sleeping more? Yes.
Yes.
So, what do you guys think about schools starting at 7 or 8? Later. So, they have shown that schools which start, so a lot of schools in India, these forward-thinking schools have started this, they open at 12 o'clock. So, what about the school? If we think about school, the schools are arcane now. They are absolutely outdated. The reason being is the structure of the school, and the schools were created 100 years ago. During when was this, the present, how the schools run, when was it created? Any thought? Industrial revolution. Because for industries, you need educated en masse. So they created schools where they can sit and teach people, and they'll be sensible enough to go and work in industry. Is that valid now? Because we need, we've got internet, explosion, knowledge is there at fingertips. Do we need schools to be structured? And teenagers do need to sleep more. The more they sleep, actually better it is. So if your teenager is sleeping, he is just restoring his mental function. He's not being lazy. So next slide. So, I just want to move on. What can we do about the sleep? So this is one resource we have that we can change and we can improve our health considerably. So the most, there are lots of medication for sleep, and repeatedly the research has shown that the behavioral techniques are 80% effective. The medication is only 20% effective. And in fact, medication that's given for sleep, like benzodiazepines and zolpidem and all, have a lot of side effects. There's direct correlation of benzos and falls, hip fractures. So it's best to get into a very good sleep habit. So, and it's again, we all know these things, but do we apply it? Stimulus control, you have it very low arousal, this thing, sleep restriction. So if you have not slept, except for if you're doing a shift, if you've not slept in the night, don't nap or sleep during daytime. So that's really important. Sleep hygiene, people are familiar with this. You keep the environment calm, have a hot bath or a shower, drink a warm in a fluid, chocolate, milk, and go to bed only when you're feeling sleepy. And the bed should be only used for sleep and intimacy. That's if you're still lucky, of course, and nothing else. So sleeping on the bed endlessly, reading in the bed, but if you have to do that because that's your habit, make sure whatever you're doing is slightly on the boring side. So if you have a TV and that's what is your habit for last 10 years, then make sure you're watching a gardening program or a decorating program than something that's stimulating or interesting. And there's a lot of research on OSA, that is the obstructive sleep apnea, and there's a very good correlation to show that if a partner is snoring, then the other partner is having chronic sleep problems. So the partner snoring should get themselves tested or sleep in separate bedrooms. Okay, and have a sleep. The most important thing, what they have found is, in Oxford they found that our retina, we all know that there are cells that are receptive to colors, rod spots. They found the third one that is just receptive to light. So even blind people can sense when the light is switched on and off, even though they don't have vision. So because this receptor is acting in their eyes when others are not acting. So we have this, and it is really important for this receptor to be stimulated for your melatonin to be triggered properly. And what do you need to do for that? You have to stand in the sun for 20 minutes in the morning. If you guys take one thing, is go and stand in the morning sun for 20 minutes. That is minimum of 20 minutes. That is very restorative. Okay, that's a very good question. They have shown that a sun on a very cloudy day in UK is 20,000 times stronger than a tube light. That's a very good question. Okay, so even the watery sun is any time 20,000 times stronger than your light bulb that you're exposed to outside. Good point, good point. Okay, and then you should avoid all this. If you're drinking alcohol, not too close to the bedtime, because you live once, you have to enjoy as well. You're doing exercise 3 hours before, and these are expected, no large heavy meals and no high fluid intake. The second one. So yeah, we talked a bit about medication then. Yeah, that's it. Thank you very much. And I hope you enjoy your meal.
Thank you. Thank you, Sita.
जागो फूड सर्व हो गया
फूड तो नहीं आया नहीं है अभी. I'm sorry, फूड आया नहीं है, वो पता नहीं कहाँ रह गया है. वो कह रहे हैं कि चला है, तो ये पता किया है, तो आ जाएगा. तो Ashok Puri ji, I would like to invite Ashok Puri ji just to say a few words. It's just a blessing really when Ashok ji is around. He's a chairperson of Ashiana charity. If you know Ashiana, then you will know that how much things he is doing. And former president of Matada Mandir Dudley. And then that was the time when the Mandir arose. That before that there was no. And then he was a former president of Shri Pashupatinath Mandir. So he doesn't keep attached. He just keep moving. जब मंदिर को ज़रूरत होती है तब वो आते हैं उसमें प्राण देने के लिए. And then he still keeps moving. And then he said कि मंदिर को अगर 5 पाउंड की ज़रूरत होती है, he just goes for 10 miles to get that 5 pounds. I think he has done many times. So Shobji, I said yesterday that one man, one vision dedicated to the service for all. Thank you, Ashokji. You come, please.
Thank you for inviting us, Ulji. Thank you for arranging. I think you are arranging, this is the 3rd time?
Yeah, mental health, I think this is mental health 2nd time probably, but I do arrange many things.
Yeah, I haven't got much knowledge about this topic, but we got some knowledge. They are testing me at the back. She had the blood pressure little bit high. I said, I have the normal blood pressure. Then she checked the age chart. Oh, you are normal. Then she checked my sugar and a little bit over. She said, what do you have this morning? I said, cereal with honey. That's why. So it's awareness of your health, and thank you all the doctors who involved, because without you we haven't got this knowledge. And with the people who attend this seminar, thank you all, and please tell the others as well. And next time when Mr. Atul arranges, please come back. And thank you very much. Thank you.
Thank you, Ashokji. You're always an inspiration. He does so many things every day. So I just received a message, I got 100 pounds more, and then he said, don't, you are on my gunpoint, then don't mention my name. So I don't see him somewhere. So if he is, then, but he's, everybody, people are so generous really. And then why shouldn't we do these kind of things? So thank you. Food is still not here. So shall we do Rituji?
Just because the food is not
Yeah, that's correct. Yeah, you know that. Because, yes.
Just because the food is not here. I'm the filler. Thank you, sir. Would you please record one of your poems? Sorry? One of your poems.
Yeah, after that, if food is not here.
मंदिर में जाके खा सकते हैं
खा सकते हैं, yes. But the food should be here when you're coming. Ritu ji,
Thank you.
please give a round of applause, please.
So my name is Ritu Sharma, and I am founder of Kushale UK, a women empowering organisation. And mental health is a big part of the work that we do, and that is merely by the understanding that mental health does not stand on its own as a problem. It's got many, many, many layers, and we've learned so much today just by being in this room here, and that is the power of events like this, seminars and meetings like this, where people who have the knowledge come and share it with the people who don't have the knowledge, so that we can fill the gaps and we can create some form of equilibrium, if not ideal. Because I really don't believe that ideal is possible unless we continue to work on this for at least 3 to 4 centuries, all of us, each one of us. I am truly humbled and honoured to be a part of today. Truly, truly humbled and honoured to be a part of today. And I truly don't believe I deserve to stand in the line of these wonderful, wise, learned, experienced speakers who I'm following from. Thank you. But I'm here to just give my 2 pence in as well. And what I normally speak about is how domestic abuse is related to mental health. Now, we do 2 conferences in a year, every single year. One in January, which is held in Walsall, if you know where Walsall is. It's held in Walsall every year, and we call it Domestic Abuse and Mental Health Awareness Conference. And the second one happens in October, in the month that is assigned to both these issues, socially, to come together and have a dialogue. We bring experts in, just like the wonderful people who were here before me, to share their knowledge and then guide us to how we can improve ourselves from where we're at, to kind of show us a direction on what actually the issue is. And when I talk about domestic abuse, and the other side of it is honour-based abuse, which is also a form of domestic abuse, I do not speak from reading from a book. I speak from lived experience. And as much as I'm not very pleased that I had to go through and redefine myself and discover myself through it, I am truly grateful that I have the voice to talk about it now, that I can actually speak on behalf of all these women who don't have a voice. And to the gentlemen in the room, can I just say that I'm not, I am biased in a way, because I do work with women for women. That's my work, that's my take on it. But in no way, shape or form, anything that I am about or the work that I do is anti-men. We do not believe in hatred. I believe, and the work we do follows the same trail, that men very much must be a part of this trail of talks and women empowerment that we're trying to work on. This awareness around domestic abuse. Now, one of our lovely speakers, she said, I'm going to talk about menopause and men are going to switch off. Which is a fair statement to make, because they would normally switch off. Menopause, what have I got to do with it? Domestic abuse, it's not my problem. It is everyone's problem, because it's happening in our homes, it's happening in our neighbors' homes, it's happening in our colleagues' lives. And from the data we have, it's 1 in 3 women who go through domestic abuse in the UK. 1 in 3. That's how big this problem is. A friend of mine, we were talking in the morning, and he goes, in the UK, is the problem that big, Ritu? It is that big. And I truly believe if each one of us decided to do something about it and continue to work on it for a few centuries, that is actually when the change would start to happen actually. We don't need to shout out slogans, we don't need to set policies, we don't really need to work on a government level, or yes we do, but the change would actually happen on grassroots level, where each one of us would understand what domestic abuse, honour-based abuse looks like,
And I also always say that yes, the mental health of a victim would be impacted due to domestic abuse, but I also truly believe that the perpetrator somewhere has a mental health issue to inflict abuse on the next person. What healthy human would want to destroy another human being, and why? Yeah? Mental health, as I say, is a wide topic. Domestic abuse, honor-based abuse are two forms of abuse which are very unfortunate because they come through people who we love, who are supposed to love us, and who are supposed to support and protect us. And it's a shame, and I am ashamed of the fact that we are in 2026 and we're still trying to find a way to get through them and to find voices to talk about them. So each one of us, if we decided to just be a little bit less judgmental, and when Dr. Saab was talking about judgments, I was thinking we are so used to judging the next person that we won't even give them the benefit of the doubt. They may have gone through something that they don't know how to handle. We don't even give them that benefit of the doubt. And they get triggered very easily. And I know, because I am working with quite a few women who are triggered at the drop of a hat. And if we just drop that little judgmental approach for now, maybe that would be our contribution to start off with. I know I'm a filler, and I hope I filled it well. I won't go on and on about it, but the food still isn't here.
No, there is another speaker.
Yes, we've got another filler, so that's good. But thank you very much for being here. Let's continue the talk. Let's continue to find a way. Let's work together. Let's associate and find how we can support each other. Each one of you guys are here because you feel for the cause. You understand there's a problem. Let's carry on, try and find a solution. Thank you ever so much. Thank you.
Thank you. Yes. Alkaji, please come. And then before that, I'll just make an announcement that there is a 21st of June, there is a International Day of Yoga. So please go anywhere where do you like. In the consulate there is an event. There is another event we are doing in a certain coalfield, which I am a part of it as well. So please come on 20th of June, 20 June ko, 10:30 till 12:30. So it is, please do come. If you need any information, you can always find me and I will get you the information. And then domestic violence, I've recently dealt with this case. It was very terrible. And then the lady contacted me and said, I don't know, what can you do? I said, I don't know, I will try. And then I managed to get her out from that mess. So it was a quite good. Thank you. Dr. Alka ji, I don't know what do I say about it. I think इनका चेहरा इतना सुंदर है ना, और ये अब दोनों मियाँ बीवी ऐसे करते हैं जैसे इनको लगता है कि भी ऐसे हम तो पता नहीं ऐसे ही किसी सांचे में से निकाल दिए हैं. But I think she is so good, Alka ji. And then I never knew that how you can relate mental health with the skin care. And then yesterday I was reading about it. I thought, of course, how much we are being ignorant about our skin, then how this can be so useful. So thank you, Alka ji, for coming and joining us. She's a very big name. I think if I tell you that is please. नहीं? Okay.
आज जो list देखी है ना उसके बाद नहीं.
But I think please do listen, and then if there is anything, she got a website to go to.
Good afternoon, everybody. I know आवाजें थोड़ी कम हो गई होंगी because भूख तो मुझे भी वैसे लग रही है. So I'll not take too much of your time. First of all, a big round of applause for the audience. Everyone praises, इसको निकाल सकते हैं दबंग की तरह. Thanks to Atul ji, everybody praises, the organizers. I will do that too because it's an amazing function. Getting so many people, such high-profile people with so much knowledge, and especially people related to medical field because they're so busy with the patients. Getting them together on a platform is a huge work. So one round of applause for Atul ji and his team. The other for us all for listening patiently. I'm not going to take too much of time. So I am a dermatologist, and when I come on the stage, people think I'm going to talk about creams and lotions and ointments. But today, I'm not going to discuss any of this or wrinkles or acne. We're going to have a discussion much deeper. Why I say we? Because I think all of you, we reached here around, I think 10:30 and 11 o'clock, they even started and it's 2. So you must be tired of listening. I want you to now interact. Ask questions. If you are hesitant asking, in a group, I have the table at the back side. I think most of you have come to me. But still, if you believe and if you want to have one-on-one conversation with me, please do come. Now, before I tell you what is the connection between skin and mental health, does anybody know about any chronic diseases? Can you name a few?
Acne. I think my boss is saying you must listen to her.
Anything else? Very common. Eczema. Exactly.
Hair loss.
Hair loss, yes. All these chronic diseases, I think, अपनी लाइफ में हर इंसान एक टाइम पे तो स्किन या हेयर प्रॉब्लम से जूझता है, राइट? What if I told you that all these names that you have said, psoriasis, hair fall, acne, are not merely skin diseases? Would it surprise you? No. It won't surprise you because you're connected. But yes, when you have these rashes on the skin, it's actually not a disease. It is your mind having an emotional connection with your skin. Have you ever encountered, I hear a lot of people when they come to my clinic, कि जब कोई इवेंट होता है, बर्थडे पार्टी होती है या शादी होती है, मेरे ब्रेकआउट हो जाता है. सुना है? या पेशेंट्स जिनको क्रॉनिक डिजीज होती है, जैसे सोराइसिस, एक्जिमा, जिसको तप्पड़ बोलते हैं, hives, I'm using both Hindi and Punjabi because I can see a lot of audience who do relate to these languages. So before an interview, people get hives or tappad. So what is all this? This is the skin and mind connection. Atulji, skin and mind connection.
You are always right,
नहीं, I'm not always right. अगर मैं सारा लंबा बोलगी तो आपने बोल देना you are not always right. So these are just examples to let you know that there is a connection and there is a much deeper connection. I'll tell you, I'm not going to go through the slide. Anyway, he's not played the slide good because we'll just have a direct talk. So I'll tell you a small story. When I started my medical practice way back in 90s, right? So I'm 58 now. I come with a practice of approximately 3 decades of practice into dermatology, and I can say with conviction that most of the skin diseases do not have their treatment on a prescription pad. You don't get the cure on a prescription pad. It is more to do with your thought process. A small story will explain everything. This is in the beginning years of my practice. I was sitting in the OPD and I saw a young woman. She had a lot of rashes around the eyes, her neck, her arms. And while I was examining her, I just asked her. That is how I do my consultation. I see the treatment, the person as a whole, not just the skin part, So I asked her, while I was just examining and talking to her, like, where you come from, I asked her, is everything fine with you? It was just that simple question, and she burst into tears. Not because of the eczema she had. It was because she was a single mother. She was looking after her old mother who had dementia. She had to balance her work life and her personal life. So what those rashes were telling, the brain was connecting with her skin. So if you have a skin concern, do not think that your body or your skin is betraying you. Rather, it is trying to protect you. It is telling you that there is a deeper cause and you need to see what it is. And believe me, like I said earlier, you must have seen also कि बहुत दवाइयाँ खाने के बाद भी लोग बोलते हैं कि ठीक हो जाता है फिर आ जाता है, ठीक हो जाता है फिर आ जाता है. Imagine so much invention and advancement has gone into medicines, but the problems have not reduced. Have they? People still suffer from psoriasis. There are still so many people who are committing suicide because of vitiligo or psoriasis. So, the takeaway today is, for medical professionals first, we all are medical professionals, and when we encounter a patient, so when we ask the questions like, since how long are you having a problem? Please also ask the question, how are you doing emotionally? Make that emotional connection. Don't consider your patient sitting in front of you. Don't label him as a patient of diabetes or hypertension or psoriasis, blah, blah, blah. Try to ask one simple question. How are you doing today? And I think that makes a lot of difference. I have seen in my life cases refused by medical colleges. I'm talking about autoimmune skin diseases and severe emergency cases of skin problems. You ask them this simple question, and I'll tell you small things. A lot of people today talked about mental stress and how to handle. So now that you know stress affects the mind affects the skin. And when you have skin problem, what do we do? What do we usually do? If you have a rash on the face, what do you do? Yeah, more than that. If you're going in you put concealers, you try to hide, you shy away, you try cancelling your birthday parties or functions. So, lot of things are happening. So that means it is stress. So it is a vicious circle. To break this circle, do simple things. First of all, we as medical professionals, or even you people, listen to somebody. Most of the people suffering from skin diseases just want to be heard. Just want somebody to listen to them. Beyond the labels, beyond everything. This is what medical professionals can do, but each one of you can do that. If you encounter somebody, lend them a patient here. Yeah, that is all they need. Talk to them, ask them, because that is all most people want. I have seen in my practice of 35 years, chronic diseases like psoriasis getting healed. So I'll not take more of your time. So that's the brand, Dr. Alka Skincare. We have clinics in India as well as here in Canada. I have a YouTube channel. If you go to that channel, you can hear stories of chronic diseases. And if still you feel you're not quite convinced that there is a relationship between the skin and mind, hear those stories. And next time you encounter somebody, just tell them, listen to them, and tell them about these simple things like proper sleep. Everybody has told all the things how to manage stress. I'll not go into the details. Simple things like having a good sleep, having a good diet, all those things do help. I am a testimonial to that lot of things can be cured. You know, when I talk cure about diseases which science says there's no cure, but if you give a person a disease-free life for maybe 10 years or 20 years, for him it's a cure. So please give hope to people, listen to them, treat them as human beings and not just labels. And in the end, just one message I want to give everybody. I think the last two is what खाना ही है ना?
नहीं बस एक 2 मिनट एक छोटी वीडियो है.
Okay.
Krishan ji, let me decide.
So there's one person after me, so I'll end with the last line. So skin and mind connections, they're not separate. They are conversations your mind is having with your skin. And skin, please, next time you see a skin specialist, don't just think that it's all cosmetic. बहुत सारे लोग यही बोलते हैं, अच्छा आप cosmetics करते हो, aesthetics करते हो. So skin is not just cosmetic, it is emotional. it is psychological, and it is deeply human. Thank you.
Thank you, Alka ji. It's very nice to hear from you. और मैं हर बार सोचता हूँ कि ये कहते हैं कि we will call you, we will invite you on tea, but they don't. But what do you mean? मेरे को नहीं जानते? Don't you know me? That's another thing. Okay, so I think program is coming to end. I'm just showing just a video from our Universal Daycare Center. It's just a 3-4 minutes video. Please do listen to it. And I got a couple of announcements. Mona ji will take 1 minute and Rakhi ji will take another half a minute. Half a minute? Okay, Rakhi ji, you can take 1 minute. Okay, but quickly before we start this video.
A quick announcement is, because we all are aware that this is a month for celebrating the International Yoga Day. So here at Guru Ravidas Bhavan, we are celebrating it on coming Thursday, on 18th of June, from 10 o'clock till 11:30. So you all are welcome here. Our consulate journal is also joining us. And on the day, I am going to cleanse your aura with the salt, with the fire, with the crystal. Sorry?
High blood pressure, they said don't take much salt.
No, they don't have to eat it. It's just their aura. Aura is energy field. Good, you are quite. I thought you have a good sense of humor. So please join us. We are having very simple stretching exercise for your joints, and we are having another kind of healing on that day. So if you want to rejuvenate yourself, if you want to purify, detox your unhealthy thoughts, emotions, and aches and pains, please join us on 18th of June at 10 o'clock. Thank you so much.
Thank you, Mona ji. Thank you. I would, Rakhi ji, please do come. And there is another very important information she need to say. Because if I don't, then she is going to kill me. You know that she is a killer.
She looks like one.
Yeah, she does.
Namaste everyone, but don't listen to Atulji, I'm not that cruel. My name is Rakhi Bansal and I'm Joint General Secretary of Gitanjali. Most of all you know what Gitanjali do, and Atulji just said you can just announce here. I was not prepared at all. So Gitanjali is going to do 2 events in July, and it's on the same day. So first one is Gitanjali Circle for Young Creative Writers, and in that one we have a very good event happening on CGI on 18th of July from 11 a.m. to 2 p.m. And it's lunch included, and it's a free event. There you can see how our talented young children and youths are performing in language and literature, and also they are going to show their talent, which is one part. And also from this year, many of you may remember Mr. Talwar, Mr. Krishan Talwar. We are going to start a new award remembering him, and he was a very dedicated person for literature and literary circle in Gitanjali, and especially for youth. So we are arranging a award ceremony for youth. There are 2 groups, age 4 to 15 years old, and from 16 years old to 20 years old. They have to send their own original creativity, writing to us. Please contact for email, and we are going to announce the winner on the same day, on 18th of July, for the first time in UK, an award for young creative writers. So that's 2 announcements. Thank you very much for listening to me. Thank you.
Thank you, Rakhi. I think I will say something else afterwards to the video first, and then I need to say thanks to the speakers. Please listen to this Universal Daycare Center. They are staying here for last over 3 hours, and then they are really good. I know Mr. Samani and Indrani ji. I met her a few times. Don't cough on my show. I told you before. No sneezes, no coughs. So many doctors, and you can't just be coughing there.
Universal Daycare. we are committed to providing a need-based, person-centric approach for people that are vulnerable, isolated, and individuals with learning difficulties and challenging behaviors.
Hello, my name is Jaran Panda. I'm the founder director of Universal Group, and our main ethos of the company is to provide care at a level which is second to none.
We offer daycare, outreach, and care escorting services. Some of our services include sensory growth, gardening, exercise, salon, swimming, park visits and outings, dementia care, and many more.
Hi, my name is David. People know me as Tom. I'm the CEO of Universal Daycare and Universal Groups. We started this journey 6 years ago. If I'm not wrong, we started with one point. Back in those days, we thought we're not going to make it. We're not going to give the service what we are thinking and what we're planning to give to the community. But we made it. We had a lot of up and downs in the business. We took a lot of challenges to make sure we reach the targets where we are thinking of, and we expanded it recently. At the moment, we're looking after nearly 50 kids with nearly 75 employees.
We have been providing these services with utmost passion, emotion, and resilience, and will continue to empower our clients to be as independent as possible. All our staff are DBS checked and fully trained. We are conveniently Universal Daycare. We are committed to provide our staff are DBS checked and fully trained. We are conveniently located in Westbury and welcome customers from across Birmingham, Wolverhampton, Dudley, and Sandwell.
I'm the assistant manager. Some have autism, some have special learning difficulties, learning disabilities, and we make sure everyone participates in the activities, no one's left out.
I work at Universal Daycare. I start my day off by going on the van, the Universal van, to pick clients up from their respective homes and bringing them to the center where we have lots of activities that we do during the day, from trampoline to outdoor activities to indoor activities, cooking sessions. We go out for daily walks and lots of exercise and fitness activities as well to keep them, stimulated and keep them active the whole day until we take them back to their respective parents in the evening as well, after they must have exhausted themselves in the daycare during the day.
We've been going for 6 years now, and we believe that we still have a lot to offer for the community as far as care is concerned, because there is a need, very special need for care services which are not being provided for. Integration into society is very important. Making this knowledge, we are able to provide very good quality of life and giving them the independence and the interaction with society that they so desperately need.
Our main motto is to spread as much as into the community and make sure no kids are left alone, feeling like I'm alone. No, we are with you. Universal family.
message of whether they have
Thank you, Akhilji.
Thank you.
Thank you.
Thank you. It's very important to know these services. We go to hospitals and many other things, but these are very important services for the community. I think we can smell foodies here. I'm just going to put another flyer. Just for your information, you can see. So I think I would say thanks to all the people who have stayed there for 3 hours or 3 plus hours. So thank you all. And then my speakers. So you have seen their profile. They are how big and how busy their people are. And then giving their that much of time for only 10 minutes, 5-7 minutes, it's amazing. So it shows that how much they care from heart. So thank you. Sita ji, thank you Bhavna ji, thank you Kishore ji, thank you Sam, thank you Dr. Satyavara Sharma ji and उनकी पत्नी Dr. what आपका नाम क्या मोना जी? Dr. Mona Khurana ji, Ritu ji, and then Universal Day के Indrani ji, and it's our so many people are here. Our Insight is here, our Sapan Parivar is here. So I'm so glad, and then food is here, Satish ji and Anu ji, and then Dr. Alka ji is here. She is still busy outside, back and behind, speak talking. It's very important area. I think I never realized that I must accept this, that skin can be a mental health. So it is amazing when I saw her profile last night. So it was eye-opening. So thank you. Rakhi ji is a very happy, the lady who came. I think I've tell everybody I must tell now. She is so amazing with the directions. So no. I think the signal is not to tell, so I will leave it to me. So okay. Thank you. So thank you everybody. Thank you everybody. So you have your attendance has made
Do you have the investment?
Me.
No. I don't want to. Why not?